Good morning, everybody joining us. We're just waiting for everybody to join us from the waiting room, and then we'll get going. There's quite a few people just joining us now. We're nearly there. There's an awful lot of you today, which is absolutely fantastic. Just waiting for the last few to join us in the main room. Nearly there. Hope everybody's got their cups of teas ready with them. Changed out their pyjama tops. Ready to go. Okay, fantastic. So good morning, everybody, and thank you so much for joining us to this second Lincolnshire General Practice Nursing and Healthcare Assistant Conference. And this is the first one we've done via Zoom. It's going to be absolutely fantastic. Please bear with us if we have any technical hitches. Hopefully we won't. But as you know, we're all adapting to this new way of working and new way of working with Zoom. So a bit of housekeeping before we start. We'd really encourage you all to keep your videos on. It's fantastic to see your lovely smiley faces. If you could mute throughout, it just helps reduce all the background noise. We would encourage you to put your gallery on speaker view, and the way to do that, if you click the top right hand corner where it says view, you can choose between gallery or speaker. Gallery lets you see everybody, speaker lets you see the person who's speaking. We've got a very special guest joining us, so you'll want to see who that is. We are going to be recording this today, and we are going to be taking some pictures for press and social media, so if you're not happy to be involved in that, please do turn your camera off. We'd also encourage you to open the chat button, so you'll see that either at the bottom or the top of your screen. If you go to where it says more, click on that, 3 little buttons. It should allow you to open the chat, and you can engage with us throughout the day, and we'll be keeping an eye on any questions you may have. So today has been brought to you by some very, very hardworking people. So just want to start by thanking those people who have made today possible. So the Lincolnshire system partners, so Lincolnshire LMC, Lincolnshire Training Hub, CCG, STP and Health Education England, and of course all of our generous sponsors and the people behind the scenes here. So Susan, Caroline, Kate, Hannah, Lisa, apologies if I've missed anyone. There's been so many people working so hard on this today. So without further ado, we're going to get going. So we're going to start today. We've got a very, very special guest joining us today. So hopefully if Hannah is there and Ruth, are we ready to admit our very special guest before I announce them?
We are, yes. In fact, she's already with us.
Fantastic. So I'd absolutely delighted and bowled over to welcome our special guest today, Her Royal Highness the Countess of Wessex. Good morning, ma'am.
Hello, how are you?
We're all fantastic. We are just bowled over to have you with us today. Thank you so much for giving up your time. And before we start, today we're going to be celebrating the Year of the Nurse, but we're also celebrating something very special today, which is your birthday. So I'm sure everybody will join me in wishing you a very happy birthday.
Thank you very much.
Birthday.
Thank you. Thank you. My son's tutor group have already sung happy birthday to me this morning. I'm sure you could probably do a bit better than they did, but it was very sweet of them.
Do you know what? I've run a conference before where we've tried to sing on Zoom and it did not work at all. So we're not even going to go there today.
I think it requires an awful lot of practice and an awful lot of editing as well.
Absolutely.
But thank you so much for inviting me along this morning. It's lovely to see all of you, and I'm really glad that you've been able to take time out of your incredibly busy days to be able to attend this conference. It's clearly worked very well the first time round, which is why it's being repeated, and I'm sure that you'll all gain a huge amount from it. But more than that, I also wanted to say thank you so much to all of you. Doesn't matter which part of the system you're working in, whether you're general practitioner nurses, whether you're healthcare assistants, we all know how much this whole pandemic has put on you, and we're hugely grateful for all of your hard work. You may not necessarily be personally in the front line of having to care for people with COVID, but the repercussions are being felt right the way throughout your entire body. So thank you so much for everything that you're doing. Many of you started to see reports saying, you know, we never signed up for this, and I'm sure you didn't, but you have done your whole profession really proud, and we couldn't do this without you, and we are so lucky to have all of you working so very hard. Thank you for everything, and also to the nurses that are working in surgeries around the nation as well. I had a very wonderful birthday present yesterday. It was an early birthday present because my father received his vaccine. He's 89 years old, and I'm so happy that he's actually got it. It's a huge weight off my mind. And he was full of praise for the way that it had been handled, and how quick and easy and simple the whole process was. And I know that wouldn't be happening without the care and attention of the nurses out in general surgeries. But for those working in all other different environments, whether you're in hospitals, as I said, whether you're in care homes, all of the different environments, I know you're working incredibly hard. So thank you so much. And I really do hope that you gain a lot from today. It's a chance to pause, a chance to take a breath, and a chance to accelerate your learning, to be able to push forward to the next level. And I know that's what a lot of you want to do. That's what you should be doing. And I hope that today will be fascinating and interesting and really beneficial. But it's a wonderful opportunity for me to come along today and just say thank you so much. And I hope you know how proud everybody is of you. I hope your families are doing well as well, because I know that they will be feeling the strain as well back at home. But I know that they have probably told you already how very proud they are of all of you. But to add my thanks on behalf of us all, thank you so much. And thank you very much, Helen. Would it be possible for me to ask maybe a question of one or two of the nurses? That would be really wonderful. I just wanted to hear from maybe one or two of them as to how they're coping. You know, what this is all meant for them. As I said just a minute ago, you know, we've read reports and seen people saying, you know, I never signed up for this. And, you know, you've all had to go far beyond probably what you thought you would ever have to do or dreamt that you would have to do. But my goodness, you've done it well. So perhaps if one or two of them might be prepared to say something, that would be really lovely.
Thank you, and thank you for such wonderful words there. What a boost for us all. So I'd like to open this up to the floor now. Would anybody like to answer the question that was posed there? How is this affecting us? How are we feeling right now? And that's an absolutely wonderful, great question to ask. So if you would like to answer that question, please just stick in the chat, stick yes in the chat, and we'll come to you and we'll get you to unmute. And I'm sure we've all got stories to tell, and we've all had experiences of how difficult this has been, the ups as well as the downs. And we know that sharing our stories and sharing what we've been through is the thing that will protect us and get us through this. So it's a wonderful question. So let me have a look. I think Sarah Hall would like to answer. Sarah, do you want to unmute yourself and answer the question?
Hi. So I work at a GP surgery over in North Highcombe in Lincoln, and I deal with, I'm an advanced nurse practitioner, but I'm also clinical lead for cancer and palliative care, and I also do adult and children's safeguarding, and I do anxiety and depression. And I'm finding with the COVID that what's happening is, whereas the anxiety and depression side, people, I would have probably, because we can have, I don't know who else is GP attached, but we can have sort of 40 to 50 calls a day. And I've noticed that whereas with the anxiety and depression side, I would have probably 8 calls per week. I'm literally now having probably 15 at least calls per day on my list, and some of these calls are taking 45 minutes at a time. Yesterday alone, I had 5 patients suicidal. So it really is mentally draining by the end of the day, when you've got 15-20 patients that you're trying to tell them that everything's going to be all right and everything's going to be better, but knowing in your heart that actually it's not going to get better anytime soon, because all of the resources that were available and are usually available face to face, because that's all they want, they're not available at the moment. The services that were available are no longer available, and it's the same for the cancer patients that I have. The resources that they had and the support that they had isn't the same as pre-COVID. That's not available anymore. So I'm supporting and helping all these people as much as I can, and I will, where I can. Obviously the cancer patients on chemo I can't, but where I can I will bring the patients in face to face and sit and give them as much support as I can. But emotionally and psychologically, the impact on people it's having is astronomical.
What about the impact on you, Sarah? How are you coping?
I'm coping okay, actually. Last year for me, from a personal level, was not me, but for my family, was absolutely horrendous, because my own dad in January tried to commit suicide, and then my daughter went through a terrible time where she also did the same, and so I had to go through that and then come in and deal with patients who were suicidal. And obviously you can't, oh, and then my brother also collapsed and nearly died. It was last year, and I've got a little grandson who's got really terrible health problems. So I don't know, it was almost like having to deal with the patients, all their anxiety and depression. I don't get depressed, thankfully, but hearing that other people were going through such traumatic times as well, sometimes I find it difficult, especially when I've got sort of 15, 16 in one day. But my priority is being there for the patients and giving them as much support as I can. And then all of a sudden one day you'll get this bouquet of flowers delivered, or a nice little card saying, you know, how much you've helped them. So it just makes it all worthwhile. And I think personally I've got the best job in the world. So
wow, that's fantastic. Yeah, I mean, goodness, you've taken an awful lot on, and then obviously all of the issues that you've got on the personal side of life as well. I'm so sorry that that's happened to you.
It's all right now. I mean, everything's brilliant this year. You know, my daughter got a new relationship and just got engaged. My dad's sort of seen the light at the end of the tunnel. You know, touch wood.
Good. That's good to hear. And well, thank you for everything that you've been doing, for all of those people that have been calling you, and how clearly they've needed you and your strength. But thank you very much indeed, and thank you for sharing that with us today. Helen, I don't want to I'm probably run over time already. So thank you very, very much for having me today. I hope you have a brilliant conference. And I hope you know how really valued you are, every single one of you. We are so lucky in this country to have the NHS, and I just thank you so much for everything. And so that's really it from me. I probably ought to go and eat some cake now or something.
Thank you so much for giving up your morning to come and speak to us. You have no idea what a boost that will have given our nurses here today. It's just so wonderful for you to come and join us, and thank you for asking that question, and thank you to Sarah for sharing your story, which I know will be echoed throughout all of the other nurses who are here today. So thank you so much, and enjoy the rest of your birthday.
Thank you very much indeed. Have a wonderful day, everybody. Thank you so much. I would stay, but I won't understand a word that you're talking about. So thank you very much, everybody. Goodbye.
Thank you.
Thank you.
Bye.
Bye.
So how fantastic was that? And thank you, Sarah, for sharing that. I'm sorry we didn't have time to get to the other people who wanted to speak, but I'm sure actually the words that Sarah shared there and Sarah's stories are really ringing true with lots of people, and particularly how we're really good at as nurses at focusing on the positives as well as the negatives. You're really good at keeping going and that camaraderie. So shall we make a start then with the rest of the conference? I don't know how I'm going to quite top that. So hopefully you're going to be able to see my screen. Can everyone see that? Somebody give me a thumbs up if you can see my screen. Yeah, fantastic. Yes. So got 5 or 10 minutes just to give you a little introduction to this conference today. So to let you know who I am, I may have met some of you before, but my name's Helen Garr. I'm a GP and I'm Deputy Director of NHS Practitioner Health, which is a free national confidential service for mental health and addiction for doctors and dentists, but coming soon to more NHS staff. And I'll tell you a little bit about that at the end. My background's in psychology and also nursing. I was a nurse for 7 years before coming into medicine, and I finished my last shift as a nurse on a Sunday night on the surgical admissions unit at Nottingham City Hospital, and I started my first job as a JHO at 8 o'clock on the same ward on the Monday morning. So I've a little bit of insight of what it's like to be a nurse. I know just how hard it is. There's a reason I'm not a nurse anymore. It's so blooming difficult. All of my work is around supporting the well-being of healthcare professionals. So I sit on the RCGP and the BMA wellbeing boards, and I also work with Public Health England as a clinical champion for physical activity, so more of that to come. So I'm well placed today to support you in your day, which is all about you, which is all about motivating you, thanking you, letting you know you are loved, you are valued, you are supported. And hopefully I'm going to bring you a few little ideas about that right now. So I want you to start by having a look at this picture. This is my dog, Eileen. Now, she's called Eileen, so I have to shout, "Come on, Eileen," when I'm in the middle of the park. Now, dogs are very mindful creatures. If there's a smell, they'll smell it. If there's a food, they'll eat it. I want you to start this conference by being like Eileen. So I want you to sit now for a couple of seconds. I want you to sit back in your chair, feel your feet on the floor, close your eyes if it feels more comfortable, and just take notice of how you're feeling right now. Notice any areas of tension in your body. And I want you to take 2 deep breaths. I what you've done there, we've just grounded ourselves. We've just started our meeting the way that Google, AOL, Nike, the big corporations start their meetings, with a few seconds of mindful grounding. I want to invite you to be truly present today. I know what we're like as healthcare professionals. We multitask all the time. But if we are able to be truly present and listen to what's going on today, we will get far more out of this. So thank you for joining in now. So starting with a massive, massive thank you to you all. We've heard from Sarah just then. I know how hard you are working. As if we thought it was possible to work any harder than we already were, we now are. I know things are difficult. I know you've got things going on at home as well as work, and you are coping with it all. And I want to say a huge, huge thank you for all of your hard work. We are so proud of you. I know that some of you feel like you might be hitting a brick wall at the moment. I know I am. It certainly feels like my tank is empty. How am I going to keep going? And that's normal. And that's what today is all about, to give you that time to pause, to reflect, to get some CPD. We've got some amazing speakers coming today. We've got the launch of the Shiny Mind app, and we'll talk a little bit about that later, which is fantastic. So this day is all about you to top up your tanks a little bit, give you a little bit of energy to start climbing over that wall, because this will pass. Everything does. It may pass like a kidney stone, but it will pass. And we have this brilliant hope with the vaccine. It was wonderful to hear Her Royal Highness talk about her father getting the vaccine, and you could see how much hope and joy that brought to her. So I want to check in with you. We know that if we check in with ourselves and with each other, we've more chance of coping with what's going on right now. So I want you to have a look at this temperature thermometer on here and have a think about where you sit on this thermometer. So hopefully in a second, you are going to see a poll appear on your screen. Can you all see that? Now this poll is anonymous. I want you to tick where you're sitting at the moment on this temperature thermometer. Now, I certainly have days when I'm in the red most of the day, often by the end of the day, and when I've had, like Sarah said, lots of mental health patients that can be really emotionally draining. My tech's not working, my kids want homeschooling, there's emails flying in. I certainly have some red days. So this is anonymous, but we know that if we check in with ourselves, it helps us be able to cope, be able to acknowledge how we're feeling and be able to do something about it. I'm going to give you a few more seconds. The airline industry have got this nailed. Before flights, they have a huddle and they check in with each other and they say, are we red, are we amber, are we green? And if somebody's red, then we're able to do something about it. And that's been proven to improve flight safety. And we're trying to bring this into the NHS. So checking in on each other is really important. Okay, most of you have voted now, so I'm going to share these anonymous results. So interestingly, none of you in the dark red, absolutely fantastic. When I do this with the doctors, it's pretty much all red. So that tells me you have fantastic coping strategies. And I know that you as nurses look after each other. So that's fantastic. Just want to introduce you to the idea of a RAP plan. You may have heard of it, a Wellbeing Resilience Action Plan. You can download these from the internet, just put in RAP plan. And RAP plans help us and our colleagues and our patients, I do these with patients, to identify the things we need to do to keep us well. So a really good part of the RAP plan to focus on is, what things do I know will help me, but I'm not doing right now. So have a think about downloading a RAP plan. Here's a good example of one. I've got an MP who I know who's got all of her staff in Parliament filling in a RAP plan. And then finally, last minute or two before we really get going, I want to let you know of the resources and the support that is out there for you right now. So we know that many of us aren't sleeping at the moment. Sleepio is a free app available to all NHS staff, proven to help improve our sleep, and we know that that's a big problem at the moment. Thinking Pit Stops, free resource for all NHS staff, and NHS Our People have got some fantastic offers numbers. There is a 24-hour text service available to all, a confidential phone line and a bereavement line, and a number of free apps. And we're going to hear about the Shiny Mind that's been commissioned specially for you in Lincolnshire later on. They offer Headspace, which is free. They offer free coaching. If you haven't availed them of the coaching offer, think about it. You've also got, I think, your coaching offer through Lincolnshire as well. I've used this coaching, it's absolutely fantastic. Other offers out there for NHS staff, Project 5 are offering coaching and therapy, the Trauma Response Network and Body and Soul, all offering free therapy for NHS staff. And then finally, NHS Practitioner Health, I've mentioned I'm the Deputy Director for, free self-referral, confidential mental health and addiction support for doctors and dentists. We are now open to senior leaders to self-refer, so anybody that is band 8D or above can self-refer in, and you heard it here first, coming very soon via the Resilience Hubs. We are going to be open to all NHS staff when the Resilience Hubs get going, so we are going to be open to all of you very, very soon. And then last 60 seconds of this talk, I want to invite you all to stand right now. We know that when we stand, when we break up our sitting time, we live longer. If you sit for 3 hours a day, it's knocks 2 to 3 years off your life. If you sit for 20 minutes or more, your lipoprotein lipase enzyme, that's the enzyme that breaks down fat, that switches off after 20 minutes. So I want you to start by standing. And we know that if we are active for just 10 minutes a day, you'll add nearly 2 years onto your life. But what we also know, if we are active, if we move for just 60 seconds, our focus will improve. And we will be able to focus on what's coming today. So I'm going to invite you to join me for 60 seconds of movement to get this day going with a bang. So hopefully you can hear this. Right, follow me. We're going to march on the spot. If you want to do this in your chair, that's fine. And then we're going to start punching. Okay, take out all that aggression. Come on, Sarah, I can see you. You're going to do well done. Right, now we're going to circle. Okay, if you want to have a boogie, you should go. And backwards. Right, punch in the sky. And down to the ground. Now we're going to skip. Get your skipping rope. And go as fast as you can. Let's see your tricks. What can you do? Oh, really good with hers. We're nearly done. Remember, this is just 60 seconds. Now we're going to do some squats, okay? You're going to follow me. You're going to squat as low as you can go. Nearly done. One more. Last 3 seconds. You're going to run on the spot as fast as you can. Faster, faster, faster. And you have done. Well done. Fantastic. So hopefully that's woken you all up. Hopefully that put a smile on your face. You're ready to go. This day is for you. Make the most of it. And we're going to hand over right now to Karen Story, who is our National Primary Care Nursing Lead for NHS England, who's going to come and give us a talk. Thank you so much, Karen. Over to you.
I don't know about you, but I'm feeling really energized. That was fabulous. Thank you, Helen. And just to reiterate that I too have the Shiny Mind app, and I've had my inspirational message of the day, which has really got me going for the day. So, hello everybody. I'm Karen Story. I'm Primary Care Nursing Lead at NHS England, NHS Improvement, and I have a national role, as Helen says, as Primary Care Nursing Lead in the CNO's team, ensuring that primary care nursing, general practice nursing is represented at the highest level in the nursing team. And I've been asked to come speak to you today around celebrating the Year of the Nurse. And although celebrating the nurse, the Year of the Nurse and the Midwife was officially last year, it has been extended to this year. So we can continue with our celebration. And I'd like to focus on a great way of celebrating the Year of the Nurse and Midwife, and that is around celebrating our emergence of leadership that's happened within general practice nursing, primary care nursing over the last couple of years. And before I go on to talk about that, I'd really like to reiterate the thanks that have been given to you this morning by the Countess of Wessex, Helen, to say thank you so much from the CNO's team, Nursing Directorate at NHS England, NHS Improvement. Thank you for the work that you do. And a personal thank you from me as an ex-general practice nurse. I know how challenging and difficult it can be anyway, but actually it's even more challenging and difficult at the moment. And as I return to help in our local vaccination centres, I'm really looking forward to working with general practice nurses again, and that will be a really fabulous experience. So can I just get the next slide, please? So I wanted to start with sharing a story with you, and this is me as a student nurse back in the 80s, quite a long time ago. But one great thing that happened to me in my student nursing experience was that I had a placement in community, and after that experience I knew, so I wanted to stay with you inside hospital. I wanted to work outside hospital in the community setting, and it just so happened I was fortunate, not by choice, by chance, that I managed to take up a role in a primary care centre, a general practice centre, which was my first introduction as a newly qualified nurse to primary care. So I had various roles in a number of general practice settings, but one key thing that I do remember is that in order to really take a leadership position, I had to leave general practice, which was very sad, work in an NHS walking centre, which was brilliant, but it wasn't general practice, which is where I'd started out. So I believe that experience in the walking centre, opportunities for development of leadership and academic education, a master's and independent prescribing, really started my career and enabled me to take up roles in Health Education England, NHS England, around policy, leadership and strategy. And I had opportunity to write a book which is going to be published this year. And it's entitled The Survival Guide, General Practice Nursing Survival Guide. So hopefully that'll be on undergraduate reading lists, and all proceeds from that book go to the Cavell Nursing Trust. So every book that's bought, the money will go back to give to general practice nurses through their hardship fund. So it's a really good cause. Next slide, please. So when we think about leadership, many of you will probably think, well, what's that got to do with me? Oops. Just wait for the next slide. Are we stuck? Okay, I'll carry on.
I can get why leadership development. Is that the right slide?
So when we think about leadership, it should be, yes. Many of, why does leadership mean to me? What does leadership mean to me? That's the next slide. Is it stuck?
No, that's it. We've got it, Karen.
Great. Okay, I can't see it. Okay, let's carry on. Okay, I'll carry on. So I want you to ask yourself, how many of you are comfortable with calling yourself a leader? So I've asked that question many times, different ways. Yes, same answer. One or two hands go up in the room, and some of you will be thinking, is it stuck? But actually, if you think about this, great. Okay, I can't see. Okay, I'm over here. Leadership's not about titles, position, or flowcharts. It's about one life influencing another. And if we think about it in that context, then every one of us is a leader. Everything that we do, we influence patients' lives, we make decisions in practice, we work with our colleagues, and without us recognizing it, we're actually influencing each other. So if you think about it in that context, all of you, general practice nurses, healthcare assistants, we're all playing a leadership role in practice. That's really important at this time. Next slide, please. So why do we need leadership development? Well, as this quote says, train people well enough, so that they can leave, and treat them well enough so they don't want to. That's at it in that context, then keeping everybody included in the team, working together, checking in with each other, as was recommended by Helen, ensuring that we're all pulling together as a team. And we're starting to see more leadership roles developed in general practice nursing. I'm really excited. I was very excited to see 18 clinical directors of primary care networks when PCNs were first launched. And even though there's 1,250 PCNs, 18 clinical directors who are nurses is a fabulous thing to celebrate. The next slide, please. So I just wanted to use this slide to illustrate how teams work. And ultimately, what we're aiming to do is to have a highly functioning team, an optimal team. And what this slide actually demonstrates is that if you're working on your own in a team, if you're working on your own and not in a team, you can be performing at quite a high level. And if you're working in a team that isn't functioning so well, that actually does have an impact on the way that you perform. So building the team, coming together, working collaboratively and getting to that optimal level is what we're aiming to do. Next slide, please. So this slide also demonstrates that working in teams, that if the team isn't functioning well, if it's what's termed as a pseudo team, then it can lead to stress, errors and injury in the workplace. So in order to get to that optimal level, there are 3 key objectives which Michael West talks about in his recent paper that he's written around compassion in nursing. It's around having shared objectives, working together, meeting regularly with staff, talking about well-being, and this really enhances well-being and the performance of care and delivery. Next slide, please. So I've used this slide here, leadership of self, making time for self-care, and there's a really key message that's coming across here today that is absolutely fabulous, and it's about recognizing that in order to be a leader in practice, whatever level, that you need to take time out for self-care. And that was a really, really key message that came across from Helen today. So you can't pour from an empty cup. If you keep giving, and we do this as nurses, we keep giving to others and very rarely check in with ourselves that everything is okay. So Helen has kindly offered lots of those resources, which I've copied down, and I'll be looking to add those to my list to share with others. But if you want to have a look at the impact, I mean, there is evidence behind, if we continue to work like this, there is lots of evidence that's been published previously around the emotional labour of nursing. So, you know, it's recognised that it is a very difficult, emotionally draining role. And if opportunities are taken to actually fill up that cup, and this is something that Beck talks about through the Shiny Minds app, topping up your cup, your emotional cup, then you are able to operate at a safer and highly functioning level. Next slide, please. So I just wanted to share some resources with you if you hadn't already had them, and where to find further information and support. Plenty of information on the NHS England website, NHS England, NHS England website. I'll make sure that you get these slides at the end of the presentation, and so that you can go to those resources and check in with them. Next slide, please. Looking after you too, coaching support. So you may have seen hashtag looking after you too, which is a coaching opportunity and a coaching offer for all NHS staff. So if the opportunity to have a coach before, somebody that can support you, somebody that can listen to you, great opportunity if you can do that, to check in using this website here. So the next slide, just to give you a bit of context of the way that you can go to all that I do. So I've been working closely with Paul Vaughan, the head of general practice nursing, and we've been leading the general practice nursing 10-point plan over the last few years. The opportunity to have a coach before, and surprisingly, because time passes very quickly, our programme comes to an end in March 2021. Check in using this website. And through the 50 investment that we had from the GP4, we've been looking and working with regional teams to develop general practice nursing. and recognizing that all of those challenges and issues that have happened previously, and I remember those, sharing my story around having to leave general practice in order to take up a leadership position. We want to give the opportunity, and we've been leading. Next slide, please. So action 2 of the general practice nursing 10-point plan talks about supporting leadership development. So we've tackled it from both ends. So we've got a fabulous general practice nursing student nursing network, which is very active on Twitter. Here's their hashtag here, and you can join them and follow them, and they'd really value your support. And it's about how we ensure that we get more students into general practice to build our teaching workforce. So GPN SNN consist of student nurses who have had a really positive experience in general practice and want to tell others about. So the next slide, we've also actions talks about supporting leadership in general practice nursing who are sharing with others the fantastic role that they've got, and so GP and SNN will continue future. We've also looked at how we might value your support and develop leadership programs for general practice nurses, recognising that there are some particular challenges, and we've mentioned and alluded to some of those today. So we teamed up with the NHS Leadership Academy, and we took one of their national programs, the Rosalind Franklin program, and we bespoke practice nurses. We ran that for the Value Your Support camp. And that was fabulous because they also connected to Beck on and the Shiny Minds magic sprinkled over to be empowered, and many have gone on to take up additional roles in CCGs, as educators, as leaders, spreading the leadership development that they've personally had with others. And then the other key area that we've supported and we're really excited about, I'm particularly excited about, is support that we've given to our clinical directors. Because the nurses who are clinical directors, for me, we teamed up with the NHS Leadership Academy and we bespoke it for general practice nurses. We ran that for the first Shiny Minds magic sprinkled on additional roles in with others. And then the other key area that I'm particularly excited about is the support nurses who are clinical directors. For me, the profession, we need to nurture them so they can continue their fare to be clinical directors of primary care networks. Next slide, please. The foundations of primary care network leadership. So why have I talked about this? Well, as primary care networks were developed in 2019, they had 3 key areas that they wanted to focus on. And actually, we've taken these 3 key areas to build further to develop our bespoke leadership program, which I'm going to talk about in a moment. So the foundations for primary care network leadership are around practical whole population health management approach. This is
We seem to have just lost Karen there. I'll give her a few seconds to see if her internet rejoins. Has everybody else lost Karen too? Is it just me? Yeah, okay.
Yes.
I've lost her as well.
Yeah, me too.
Okay, I think she's gone. If we'll give her a few seconds, take this opportunity to stand up and move around if you haven't already. I'm such an advocate of breaking up your sitting time. And if she doesn't come back, then the next
is building a team in general practice. Yep. And then key to all of this is about enabling and empowering leadership. And that's what we're going to talk about in the next few slides. So the next slide, please, which should be leadership behaviours. Thank you. Thank you. You're doing a great job keeping up with me. Leadership behaviours. So key things to think about when we talk about how we interact with others, how we behave in the workplace. For me, these are a few which I just want to share with you, but it's about being inclusive and collegiate. It's about investing time in relationships. It's about being prepared to seek control. So, there's not just one leader in the practice. It's a combination of all of the expertise that we all bring to the workplace that makes a really good team. So it's not about one person being in control, it's about everybody being able to take part. Next slide, please. And I just wanted to leave you with a few things, a few tools that I use on a regular basis, which help me with my leadership role. And the key one, next slide please, is around storytelling. So this is one called owning your leadership story. So the power of storytelling, we've heard that a lot this morning. So we've heard about Helen's story, which is fabulous. And we've heard my story as well. And the key thing about storytelling is it helps other people understand your role. So general practice nurses and nurses actually in general are not very good about talking about the fantastic role that they do. We're hearing about it more since the COVID period, and the focus has been on nursing. So we're actually helping the public to understand the uniqueness of the role that nurses do. It's not just about mopping someone's brow or changing beds or whatever. It's a really expert, highly skilled profession, and that's what we need to do with general practice nursing. So many of you will think, well, people, the role of general practice nursing isn't very well known. I hear all the time that general practice nursing hasn't got a voice. We need to be able to use our voice to help others understand the role that we do. So creating your story, thinking about your journey, thinking about where you've come from, why you wanted to go into general practice nursing, why it matters for you to stay in general practice nursing, the work that you do, the highly skilled work that you do every day around prevention and treatment of patients, but also around what you give back to the profession in terms of education and development of others. Next slide, please. So one of this slide is around recognizing self. So I've entitled it Managing Imposter Syndrome, and then I've crossed it out and called it Imposter Moments, because imposter syndrome implies that it's something that's a permanent state that's with us all the time. And actually it is possible to shake off this imposter syndrome. So the Shiny Mind app is a fabulous way of doing that. Lots and lots of resources that will help you understand why we think this way. Everybody thinks this way. But the key thing about this is that, those voices in your head that tell you, well, I'm not a leader, or I'm not doing a very good job, nobody recognizes what I do, etc. There's a reason for this happening. The key thing about this is how we take control of this, how we quieten those voices, how we come to find that those voices are there to help us, not just to set us off on the wrong track. And actually recognizing that is the first step. And there's some top tips here about what you can do to think about that managing imposter syndrome. Next slide, please. The other key thing that I wanted to share with you is around the power of networks. So I know that many of you do Twitter. I've already tweeted this morning about the fabulous experience of welcoming the Countess of Wessex to your conference. How fantastic is that? I've been at many conferences and I've not had a member of royalty there ever. So wow, fantastic. Well done to the team for getting that special guest here today. And to thank you personally for the work that you do. And how do you make those things happen? Reaching out to others is how you personally can make things happen. So don't underestimate the power of a network. Now, I love Twitter. Twitter, if you handle it correctly, I use 3 principles. I always tweet positive stuff, I only tweet professional stuff, and I never touch it with a glass of wine. So if you keep yourself safe, Twitter can serve you really well. And I've made some fabulous connections with general practice nurses, not just in this country, in the UK, but globally, even as far as Australia. And we're having conversations around having an international conference for general practice nursing and primary care nursing in the future when the time and conditions permit. Thank you. Next slide. So I just wanted to briefly talk about your Shiny Minds app and where it fits into this new leadership program that I've been talking about. So recognizing that there are some real challenges in primary care networks, in primary care and general practice nursing, around ensuring that the whole team is involved and included in primary care networks. We took on board some information that we heard from general practice nurses back in 2019 when we did some listening events around the country. And we heard from general practice nurses that they didn't know how to get involved in primary care networks when they were established. They didn't consider themselves a leader in the primary care network or how they could become a leader at any level. And they didn't understand population health management when in fact general practice nurses are delivering population health management every day. So building on those three key principles, we developed the CARE programme, which stands for Connected, Authentic, Resilient and Empowered. And we want our leaders, our general practice nursing leaders, to be all of those things. And the key thing about this programme is that it's not just a case of going onto a programme, learning some theory or some practical stuff and coming back into practice to make change happen, because we know that's really difficult for general practice nurses when they don't have a position of authority in the practice. So we've looked at a different model, which involves wrapping the system around the individual who is on a leadership program, leadership development program. So the system being the ICS, SDP, local CCG, primary care network, training hubs, primary care nurse leads, GP leads, anybody that wants to get the system or this training, GP leads, anybody that wants to, or individual comes on the program. And the reason I say individual is because we started with nursing, general practice nurses, because the money came. But we've been able to offer other places to AHPs because local systems have decided that they don't want to just create a uni-profession development program. They want to look at a multi-professional development program. So we've got, in some areas, for example, Nottinghamshire, they've got community nurses, care home nurses, and general practice nurses on the program together. And then in Bedfordshire, Luton, and Milton Keynes, which is our key pilot area, they've got paramedics and on the program with general practice nurses. So next slide, please. So this is just the next few slides are just information for you, really. So our ambition is for all 42 systems in England to be using the CARE programme. We've had some fabulous results with the CARE programme. General practice nurses and others have told us that they've really benefited from the programme, and it's creating a social movement. And the Shiny Minds app is key to the programme, and we hope that in your area that you might be able to build on your Shiny Minds app to consider the whole package of CARE and introduce CARE as a leadership programme in your system. So next slide, please. These are just some quotes that I wanted to leave you with. So for example, in Nottinghamshire, this is the impact that it's had on the participants on the programme. So 93% of the participants felt that their emotional well-being had improved, and 100% felt that their voice was being heard more. And 100% of participants felt that their leadership and influencing skills had improved. Great things happening. And in terms of patient care, they were able to make a difference. They felt they were able to make a difference for the health of their population and a positive difference to patients. Next slide, please. So these are just some quotes from the CARE programme. You can see here, fabulous. Thank you so much. I feel like Wonder Woman. Be lovely to have more time. Thanks to Beck and everyone around the Shiny Mind part of the programme. So lots and lots of great examples here. And the next slide, please. So thank you for listening to me. I want to leave you with this key message. When you're thinking about making change happen and you're worried that someone's going to stop you, or you might not be able to make a difference, I think this is a really good quote to remember. And actually it is about it's better to seek forgiveness rather than seek permission. And we know that general practice nurses are key to making change happen. So thank you very much for listening to me today. Hope this information has been useful, and enjoy the rest of the day. Thank you.
Thank you so much, Karen. That was fantastic. What a brilliant message. The CARE programme sounds fantastic, and what a brilliant message to tell you all that you are all leaders and you can all do this, and you can make such a difference and are making such a difference in people's lives. And I think the bit about imposter syndrome really resonated with me. I don't think there's a female, because it normally affects females, a female leader out there who doesn't identify with that. So, and lots there about the Shiny Mind, which is just the most fantastic app, which you're going to be introduced to at the end of the day. So what a start we've had. Whoever would have thought we'd have a royal joining us at our Lincolnshire conference. How just fantastic was that? And what a great speech there from Karen, really motivating. I thought that was fantastic. So we've got a break now. We're going to start back at 11:15 on the dot. So if you could get back for sort of 11:14, ready for our next session. We've got a talk from one of the reps, and then a fantastic program after that. So go off, get a cup of tea, go for a walk, go and connect with somebody, speak to somebody, don't check your emails, don't do any work, do something that fills your tank, charges up your batteries, use your break wisely, and we'll see you back at about 11:14. Hi everyone, I can see people starting to come back. I hope you had a really refreshing break. Who's going to own up to checking their emails in their break? Give everyone a minute to get back in. Hannah, do we have our next speaker with us? Do we have Dean?
We should do.
Hi there.
Oh, hi Dean, glad you're here. We're just going to give everyone a few seconds just to get back in, and we'll start at 1:15.
Fantastic. And I've only got I've got about 2 or 3 slides to share. Are you okay for me to share my screen? Because it'll be very easy, very quick. No.
Well, Sarah checked her blood results. We're really rubbish at healthcare professionals at using our breaks well and actually taking a break. We try to squeeze as many things in, but all the evidence shows us if we take a restful break, even if just for 5 minutes where we switch off, that we will get benefits. There was a study done on people who took a break. Half of the people in the study took their breaks as normal on their phones, checking their emails, and half weren't allowed to check a screen. All of the people in the study felt they'd had a restful break, but by the end of the day, the people who checked their phones showed greater levels of emotional exhaustion than the people who had a break off their phone. So it's always a good idea to really try and do something, even if it's just, sometimes I just sit in the toilet and do 10 deep breaths, something that refills your battery. Right, I think we've got most people back. We're dead on 1:15. So we're going to hand over now to Dean Potter, who is here from Novartis. Is that right, Dean? And
Yes, that is correct. Excellent, thank you. It's a wonderful conference. I don't think it beats being face-to-face, but this is a really excellent job doing it virtual. And I'll just tell you, I've only got a few minutes, so I'll just tell you a little bit about myself. I'm going to share my screen now. Oh no, it's not letting me. Okay, so I'll just describe my slides. No problem. One thing about myself is I've got some music to share with Helen's dances and moves, and if you go on Spotify and look for Me Too Rocks, I've got over 25,000 followers. So if you want some music, you'll see Lincolnshire and London. There's some musicians I collaborate with, but obviously we're all working virtually at the moment. So there's some music there if you want to add that to Helen's move arounds. Now, my role at Novartis is the community account manager. I'm mediating between secondary care and also primary care. And it's in the area of heart failure, which since lockdown, obviously there have been high risk patients. The heart failure patients are at risk of sudden death anyway, according to the Paradigm HF trial, regardless of their severity of disease. With each heart failure hospitalization, a prognosis worsens. 10% of patients admitted to hospital with HF, they do actually die in hospital. So my passion and what my value is for 2021 is I'm looking for primary care advocates and leads, and I'm hoping nurses will really grasp hold of this to work with the CVD lead for heart failure in Lincolnshire, Dr. Majid Akram, and together my non-promotional aspect will be to just to look at those side of things and the training that you'll need to get you up to scratch. Obviously, the promotional side is my products, the sacubitril valsartan, also known as Entresto. But really, I'm using these few minutes that I've got today to do a roll call. Please email me, call me if you're interested in working with heart failure patients so that we get them optimized, make sure that they get along to virtual MDTs, make sure you've got all the training you need so you know how to identify symptomatic heart failure patients and get them optimized to the right medicine for them. They won't all be for Entresto, my product, but I think if we're making sure that they're all optimized and in good shape, if they are faced with COVID-19, we know that they've got more chance of getting through this, and when we're all face to face again, it'll be something to celebrate too. And I make that with about 15 seconds left, so that's it. I'm done. Thank you very much.
Sorry that we didn't get to see your slides, and
That's all right. They can email me, I'll email them.
But we can certainly share them if you want to send them to the organisers. So thank you very much.
Thank you.
Thank you, Dean. So we're now moving on for the next half an hour to learning disability reviews, and we've got Jackie Wilmer, who is the nurse practitioner from Linden Medical Practice, here to share her wisdom. I think this is going to be a great session. Jackie, do we have you with us?
Yep, I'm a practice nurse, actually, not a nurse practitioner.
Oh, I'm so sorry.
Not that it matters, but I don't want any.
Have I elevated you?
You have, yes. Can I have a pay rise, please?
You deserve one. Okay, so over to you, Jackie.
Okie dokie then. So my name is Jackie Wilmer. I've been a practice nurse for 16 years and currently the lead practice nurse at Linden Medical Practice here in Lincoln. Most of you, I'm sure, may have come across me at some point on the circuits, updates, etc., etc. So I've been asked to do this presentation today because learning difficulties health checks at the moment are really, really high profile, because we're seeing lots of untimely deaths, really. And also there's some disparity across the region about how these health checks are being undertaken, who's undertaking them. Some of us have different templates, some of us are using different skills. So really, this is just to share with you what I do. I'm by no means an expert, but I have been doing this for 10 years. Really, on the inception of health checks, when they first came out, I just got asked if I would take them on. And over the years, I have to say, it's become a passion. I really feel so strongly about learning disabilities and giving them the best care we possibly can. Now, it's a huge, huge subject to go into in half an hour today, and I do have a few slides. If you would like to ask questions, I'm very happy to ask questions, discuss any case studies if we have time, but can we chat at the end, please, so that I can get through all my slides. I've also got lots and lots of stuff, resources and things, so if anybody wants to email me as well, I'm happy to share what I've got. I'm happy to support anybody that's new to doing learning disability health checks. You know, just give me an email. Okay, so I'm just going to move on to the next slide, please, Ruth. So, oh, one back, please. There should be key learning points. If you haven't got it, it should be there.
It's there.
Can you see that? We're on key learning points.
Oh, here we go. Yeah, thank you. So it's going to be a bit of a gallop, I'm afraid, but today, hopefully, we're going to look at the definition of a learning disability, why the health checks for patients are so important, carrying out health checks effectively, action plans and care planning, which I know people get a bit stressed about with having to do the care plans. Okay, I've lost my slide. How to make reasonable, here we go. How to make reasonable adjustments within your practice, best interest decisions, and actually how to access specialist help and support. Because I think a lot of nurses out there, and certainly I felt like that at the beginning, that who do you turn to when you've got a problem? You know, who can help you and who can support you carry out these health checks effectively, and signposting who to get advice from. So I've got a list at the end for you for all that. And I've got lots of references that you can chip into as you go along. Okay. So the Department of Health defines a learning disability as including the presence of, so a significantly reduced ability to understand new or complex information, to learn new skills, and impaired intellectual functioning with a reduced ability to cope independently, so impairment of adaptive social functioning, which generally started before adulthood, you know, the age of 18, and has a lasting effect on development. And usually they have an IQ of less than 70. Now, learning disabilities, this is just in a nutshell, but the range of learning disabilities is huge. So you will get lots with really quite high functioning and others that are very, very profound learning disabilities. Also, the definition encompasses people with a broad range of disabilities. So the presence of a low intelligent quota, IQ, alone may not indicate a learning disability. So alongside an IQ of less than 70, difficulties with functioning in 2 or more of the following areas would be expected, okay? So communication, caring for self, living at home or independently, relating to others, directing self, using community resources, academic functioning, and working health and safety. At the same time, patients with a learning disability will often have far more complex health needs than the general population. So, for example, 40% of people with an LD will have some level of hearing loss. People with an LD are 4 times more likely to develop dementia than those in the general population. 50% of people with Down syndrome may have a congenital heart condition, and around 10% will also have problems with the thyroid gland. People with an LD are 58 times more likely to die before the age of 50 in the general population. Now that's scary, you know, that is huge numbers. And also epilepsy is more prevalent in LD cases, especially in children, and can be a cause of early death if not well managed. So straight away, we're sort of seeing there's this complexity with a lot of learning disability patients. Next slide, please. Okay, and the next one, please. And the next one, please. I'm forgetting to say next slide, next slide, sorry. So, oh, back one, Ruth, sorry. Key point, thank you. So, learning disability should not be confused with a learning difficulty. And I think this happens a lot in general practice with the read coding. So I think sometimes when learning disability is read coded, learning difficulty often pops up instead. So it's really important to check your registers and make sure everybody is on the right register. So a learning disability is not dyslexia. It's an educational term, okay? So presence of physical disabilities only, stroke victims, presence of mental health problem only, ADHD, cerebral palsy. Now this list is not exhausted. There's lots more, okay? But there's somebody called Tina Olga that's in our area. So in each area, you will have an acute liaison physical nurse. Now they're really, really good, and they should revalidate your list every year and come to the practice. So some of you may already be aware of that and have already had your LD list validated. So what they will do is look at each patient on your list and just make sure they are a learning disability and not a learning difficulty. So this is going back to some sort of, next slide please, sorry Ruth. I'm not used to doing this. So this is some grim statistics again. So the Learning Disability Mortality Review Programme, if any of you have heard of it, the leader, have found that patients with a learning disability are dying up to 30 years earlier than the general population from preventable causes due to health inequalities and barriers to accessing adequate healthcare. Common causes of death are constipation, pneumonia, aspiration pneumonia, sepsis, epilepsy, dementia, heart disease, diabetes, and, this is the scary one, inappropriate use of DNA CPR. And at the beginning of the COVID pandemic, when everybody was encouraged to get these respect forms in place and these DNR forms in place, I think there were a lot of inappropriate ones. You know, if this is going to happen, it needs to be on an individual basis and fully assessed, rather than just assuming that either somebody's got dementia or a learning disability, that actually their quality of life is less superior to somebody like ourselves. Okay, so that's a really, I think, a really important keynote. The Department of Health back in 2009 has recognised that undertaking regular annual health checks are proven to improve quality of life, identifying unrecognised health needs and life-threatening conditions. So this is just giving you that background to why they're so important. The next slide, please. So people with a learning disability may find it difficult to access adequate healthcare due to the following. Again, lots more things, but I'm just trying to trim it down. So fear and anxiety related to visiting healthcare providers, such as their GP or dentist. Difficulties with communication, such as speech, comprehension, coupled with lower levels of literacy skills, hearing or sight difficulties. Poor mobility, mental health problems such as depression, alcohol or drug dependency, or overlapping learning difficulties such as autism or Asperger's. Social problems such as homelessness, no next of kin, advocate or support system in place. Now, learning disabilities, as I say, they sort of, so many complex cases out there and so many sort of differences in how they present. And all these patients on here were presented at our surgery. So we do have homeless patients. We do have overlap with alcohol dependency, drug dependency, and it's very hard to reach them and get them to come in and engage with them. So it's important to look at how you can engage them and how you're going to get them in. What reasonable adjustments can you make to support them to come to the practice? And we'll talk about that a bit later on. But it just shows how challenging it is, you know, and especially when patients have something like autism, Asperger's, they really need that routine, and coming somewhere new is really, really scary for them. Next slide, please. So equally, patients with a learning disability may be unable to fully articulate to health professionals signs and symptoms of illness or diseases, such as feeling generally unwell, actually telling you where the pain and discomfort is of a symptom. You know, we all go into the doctors and say, well, I've got tummy pain. And for us going to the doctors, I think if somebody asks you where the pain is, it's often hard to say where it is. However, for somebody with a learning disability that can't articulate that, it's very, very difficult. And I think for clinicians, it's hard then to sort of find out and get to the bottom of it. So it's quite challenging. So they can't always tell us about the onset or longevity of symptoms either. So they can't always tell us about things like weight loss or gain, loss of appetite, if they've got swallowing difficulties. They can't maybe tell us about changes in bowel habits or passing urine, if they've got problems with periods, you know, or hormones, all these things, you know, that we take for granted when we go to the doctors, and we can just say, well, I've got this, this and this, you know, when they come in with a long list. You know, a patient with an LD may not be able to do that. So therefore, an annual health check is a key factor in identifying any health needs and ensuring these needs are met and actually preventable deaths are avoided. Next slide, please. So all annual health checks should be carried out by experienced practice nurses, practitioners and GPs. Now, this is nothing against healthcare support workers, so please don't be offended. But because of their complex needs, it really does take expertise and sound clinical knowledge to be able to do this effectively. Because if a patient has a learning disability and can't communicate, they may have a support, well, they will have a support worker with them, but you need to be able to look at the whole patient and look out for subtle signs that, you know, body language, things like that, that, you know, over time we're very good at doing. I mean, patients often have all sorts of different things that you might not imagine, you know, and actually they may be feeling all right, but they may be pointing to something constantly because that is just behavioural. So again, it's being able to tweak that out and identify that. So recognised templates can be used, but an LD check should never become a tick box exercise. And we're all used to templates now, and they're great. They're really good tools, aren't they, to help us. But one thing with templates, I find it's very easy to just go through tick, tick, tick. Yeah, I've done that. I've done that. So they should be tailored to each individual and include a comprehensive review of all their health needs. Adequate time should be allowed to ensure the health check is carried out effectively and allowing for reasonable adjustments. Next slide, please. Now, pre-health check questionnaires can be sent out to patients in advance of their appointment, which are really useful actually, and especially during the COVID pandemic, when we are all undertaking more virtual appointments. These should be an easy read format, and so the patient's able to access them easily. Now, you can do the pre-health checks just generally, actually, even without COVID, because they do save time. What we found though in the past is we do send them out with the invites and then they don't come back with them. So you end up doing it anyway. But, you know, there's lots of things you can do to make life easy. So carers and family members should always be encouraged to be involved in the health checks. This is in order to support the patient and be proactive in helping them stay healthy and follow any guidance in their health action plans. Mental capacity should be assessed to ascertain if they are able to consent to an annual health check. If the patient is deemed to lack capacity to consent, this should be documented in the notes as a best interest decision. And it's important that gets put in, okay. Independent mental capacity advocates, IMCAs, can also be invited if required. And again, that's really important. If somebody, even if they're in a care home and they've got a support worker, it should be really, really important to make sure that person has an advocate, has a voice. And there are patients out there that don't have any next of kin. We have a lot of patients that we see, and I'm sure you've all seen them. When all the mental health hospitals closed down, like St John's, many years ago, a lot of patients were just put in these places from childhood, from birth, and then suddenly they were all let out into the community. And a lot of them haven't got a next of kin, you know, and it's really sad. So I think anybody that comes to you that hasn't got any next of kin, just consider using that IMCA, especially if there's a really big decision that needs to be made about their health. Okay, next slide, please. So this is a little bit about what should happen at the actual health check. Now, I'll talk to you a little bit about who does it and how you do it, and it's entirely up to you. So what I tend to do at the practices, I do all the first bit, usually hopefully face to face, but obviously COVID is stopping us at the moment. So do all the stuff that's on the template, bloods, BP, identify if they've got any vaccinations due, and try and do that in a one-stop shop. Now, some practices will do it that they'll have the bloods done first with a healthcare support worker, height, weight, etc., BP, then see the nurse for the main template, and then the GP afterwards. Now, I know at some practices it's a GP doing it all. It's up to you how you do it, whatever works within your practice, okay? But it's making sure that all aspects of the health check are covered. So height and weight to ascertain BMI. A lot of learning disabilities, especially Down syndrome patients, have weight problems. Very difficult to manage. So it's important we identify them and then we try and help them to lose that weight. BP, pulse, and I've just put in pulse oximetry because obviously with COVID and things at the moment, pulse oximetry with some patients may be the only thing that suggests they may have some respiratory problems. Routine bloods to monitor any pre-existing conditions and to screen for any underlying health conditions such as diabetes and hypothyroidism. Again, Down syndrome patients are more likely to develop hypothyroidism. Monitoring of any pre-existing conditions. So just what you would do for anybody else. So anybody else that's diabetic, you'd bring them in for their annual review and you'd do all the things that you do in that check alongside. Memory observations. Patients with Down syndrome are at an increased risk of developing dementia at an early age. But there's a lot of evidence out there at the moment to say that we should be screening all patients with Down syndrome from 30 years of age to get a baseline of where they are with their memory. Although there is some school of thought saying 40 years now, but that is in the pipeline. So watch out for that. And I think it's an excellent idea because if you've got a baseline as how they are, if things deteriorate, at least you can see if there's a pattern. Okay, routine urinalysis, because obviously we know that can tell us quite a bit, and their vaccination history. It's really important to make sure that they're up to date, like us, with all our vaccinations. If they live in a nursing home for learning disabilities, it's important that they have a hepatitis B course, because often in some of these nursing homes, you may have patients that bite. So always check that they're up to date with their hepatitis B, tetanus, etc. Next slide, please. Also take a good history of smoking history, use of illegal drugs such as cannabis. Obviously that list isn't endless because again, going back to that previous slide, we do have patients that are homeless. We do have patients that have drug problems alongside their learning disability. Also, we do see alcoholics as well within the learning disability community. So again, it's important to identify those and get them signposted to help. Social circumstances, where they live, do they live with a family? Are they in a residential home? Have they any next of kin, any named social worker? And secondary care involvement, are they already open to LD services, a psychiatrist, psychologist, or a paediatrician if under 18 years? And just a key point, patients are eligible for a LD check from the age of 14. So also record of dentists and opticians and when they were last seen. Communication difficulties, have they got speech difficulties with comprehension, hearing, sight, any swallowing problems, are SALT already, speech and language already involved, any mobility problems. Next slide, please. It's important as well at the health checks for us to encourage them to access health promotion and all screening. So a lot of LD patients don't go to screening, especially things like mammograms, you know, because they're nervous and they may not understand it. So things that are really important that we need to help and support LD patients to get are to access breast examination, mammograms, cervical screening, self-checking of breasts and testicles, bowel screening, sexual health and contraception, diabetes prevention and CVD risks. Now, I've given you some advice and a link at the end of this presentation. Truly, the easy read leaflets are brilliant. You know, they really do break it down and make it a lot easier for them. And there's lots of links as well on there on how to access other sort of help with Makaton sign languages and things. One of the simple things that I've done with some of my ladies about mammograms, because they'll often say no, but they're saying no because they're scared. They're saying no because they don't understand what it involves. So a really simple trick to encourage ladies with their mammograms to try and show them what to do is actually to get 2 books, 2 just normal hardback books, and demonstrate on yourself, obviously with your uniform on, and you can just place the books in position and then let them feel that, so they know that actually it doesn't hurt, but there is that little bit of pressure and it does feel a little bit hard when they're pressing against the breast when they're having the mammogram. And I've used that a few times and they've actually then gone and had that mammogram done. So if you can just make one difference, then that's one person that's not going to, you know, that's not going to miss a breast cancer, especially as they're in their 50s. Okay. And if they've got support workers with them, obviously in residentials, care homes or supported living, we appreciate they are not allowed to physically examine them. So again, the easy read leaflets are really good because there's pictures that are very simplistic. And I always encourage the support workers that when they're doing personal care or just having a chat to talk to them about that. And equally sexual health, you know, don't assume just because they've got a learning disability, they haven't got a sex life, you know, but just encourage them to have safe sex, because there are some very vulnerable learning disability patients out there living independently, again, with many complex mental health problems that are open to grooming. And this is where your safeguarding comes in, you know, who are they seeing? Who are they having sex with? Is it consensual? So all these things will come up at a learning disability health check. So just be aware of those. And actually making sure if they are sexually active, encourage them to have contraception, signpost them to sexual health clinics, you know, let the sexual health clinic know they're coming in advance so they can make those reasonable adjustments. And don't be afraid to talk about things like that as well with learning disabilities. The more you do it, the more experienced you become and more confident you become with it, okay? And obviously, you know, diabetes prevention and all your health. Oh my goodness me, 4 minutes left. This told you this is a big subject. I'm really sorry. I'm just so passionate about it, as you can see. Right, so next health check. So smoking history, we've done that. So next slide, please. So each patient should have a follow-up with the GP to do the physical health check, okay? So looking for at the abdomen, etc., and looking at their bloods. If anybody is on some high-risk drugs, you can refer to Rebecca Reckles at Stomp, and she can look at their drugs. Things like risperidone in the past have been really overprescribed. You can have a copy of all these slides, by the way. Next slide, please. So, so on completion of the health check, each patient should be provided with a health action plan, which is renewed annually. Some health needs may need reviewing sooner and should be highlighted in the plan. Action plans should include each health check. Action plans should include each health need and what action the patient needs to take, who is responsible, who's going to support them with them, and they should run alongside any other action plans. I've got copies of these and examples if anybody wants them emailing. Next slide, please. So reasonable adjustments. Reasonable adjustments mean making it easier for the patient to access. So being flexible with appointment times, home visits, wheelchair access, larger rooms, provision of easy read, Makaton symbols, provision of interpreters, IMCAs, family, offering nasal flu to those that are needle phobic, even though they're over 18. You can do it. Don't make assumptions, just ask. Next slide, please. Really sorry, I'm rushing. This is really good. I love this acronym. So remember, all health checks should follow the personal principles: person-centered, evidence-based, rights-led, seeing the whole person, open, independent and challenging, nothing about us without us, action-focused, living life in the community. Next slide. It's like speed dating. Not that I've done that. Okay, so where a patient with an LD is thought to have the capacity to make decisions regarding their health needs, then capacity should be checked. Okay, where a patient is deemed to lack capacity and consent, consent, this should always be a decision specific, as you all know about the Mental Health Act. A best interest decision should be made when acting at all times in their best interest. So simple scenario is whether they should come for a health check. Yes, they should come. It's in the best interest. Gets more tricky if it's something to do with cervical screening. They can't consent, and you've got a relative or a parent saying, I want them to have that cervical screening done. It's important. So then you're going to then do a best interest. You're going to do a capacity assessment. You're going to have an MDT, because you're not going to do a cervical screen on somebody that's actively saying, no, 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 I don't want it, if the risk is low. But okay. Next slide. Sorry. Oh, I feel a bit stressed. So learning disability health checks are not always straightforward. Many of the patients, as we've said already, will have complex issues, and these will be raised in the consultation. Each region has an LD physical health nurse, okay, who can offer you loads of help and advice, and they're responsible for doing your register. Lincoln Hospital and Pilgrim Hospital have acute physical health nurses. Now, these are brilliant. So if you've got somebody that needs to go into hospital, they can support them on that journey. Care homes can provide hospital passports. Brilliant, especially if they get there and say no, they don't want something doing, which they don't understand what to say no to. And the support packs out there to help you carry out health checks in primary care that's provided by the LCCG. And I've got all that I can send out to you if you would like it. Next slide, please. I think we're nearly done. Okay, so you'll get these slides. This is all the contact numbers you need. Really good resources on there. Get the help, get the support if you need it. And then my final slide is references, which you can look at. Now, I've also done PSDs that you can use. I've got best interest letters that I formulated when you are inviting people out for flus and all sorts of things, case studies, whatever you want. If you want any of that, I can email it out to you. Whew. Is it gin o'clock?
Wow, Jackie, that was amazing. You're brilliant. You really make me smile. Give Christmas a run through.
I feel a bit stressed.
The next slide. Oh yeah, you did brilliant. We are just dead on. We've gone 1 minute over. There was a question, and I'm just conscious of time, but I wonder if you might want to answer that question in the chat for everybody. Which the question was, any recommendations for how to do learning disability tips remotely? So I'm going to let you write in the chat for everyone. But that was fantastic, Jackie. Really wonderful. And the mammogram tip, I mean, that small tip changes lives. That's leadership right there. That's what Karen was talking about, making a difference. It was brilliant.
It was just because I've been doing it 10 years now, so it's a learning curve for us all. I've just been sort of tweaking it as I go along, really, you know. So yeah, so in the references, there's the GP support toolkit, okay. So that's there for you, so you can get that quite easily. All GPs were sent that toolkit, okay. So speak to your practice managers on the daily brief that we all get. There is also a new updated version that Sue Provorow's has been looking at. So in order to get all the health checks done this year, that gives you guidance on how to do them virtually. So speak to practice managers, they'll have that daily brief. They should be escalating that all down to you.
Fab. Thank you, Jackie. I'm conscious of time, so thank you, Jackie. We'll give you 2 hours next year. That was just
just such a big subject. I'm sorry.
You're just brilliant. The information you shared was just fantastic, and some great reminders in there. So we're moving on to the breakout rooms now. You've got a choice of 2. The links for both of them are going to be actually, the links for the diabetic one is in the chat. So you can choose between diabetes, which is hosted by Philippa Brown from Lincolnshire CCG Diabetic Prevention Team, and she's part of the STP's Diabetes Transformation Team, and also Ryan Morrow, who I've seen has joined us, who's the Regional Manager for ICS Health and Wellbeing. So if you would like to join the diabetics breakout room, the link is in the chat.
Sorry, Helen.
Yeah, Hannah?
It's the opposite way round. So
I'm sorry.
Diabetes is staying on here. So if you want to watch the diabetes presentation, it's
Fantastic.
Yeah.
And then the link is for the student nurses, and that's being hosted by Lucy Merrill, who's a Lincolnshire Training Hub nurse fellow and works as a GP practice nurse in Lincolnshire. So if you want to go to your breakout rooms, we would like you to come back to the main room for about 12:15 prior to lunch, so we can all reconvene. So link if you want to go to the student nurses in the chat. If you want to stay in the diabetes breakout room, stay where you are. Okay. And as you're all doing that, I'd encourage you to, again, just to have a little walk around, because remember, if this was a real life meeting, you would be now getting up and walking to your next room. And when we're doing this virtually, the temptation is just to sit on our sofas all day long. So I can see Victoria have a little walk around. Fantastic. So we'll give you a few minutes to get into your breakout rooms. So we assume people still in this main room are wanting diabetes. So have we got Philippa and Ryan?
Hello, yeah. I think
Yes,
Philippa-
hello.
Fantastic. I'm going to hand over to you.
I don't know how to get in. Oops, I'm just going to mute myself.
Thank you for the introduction, Helen. So my name is Philippa Brown. As Helen said, I actually work for the CCG and the STP alongside my colleagues in diabetes transformation. And I work a lot with the National Diabetes Programme, which is where Ryan comes in as our regional manager for our provider. So what we're going to do for the next half an hour is go through why we think diabetes prevention in Lincolnshire is so important and why it's a particularly hot topic at the moment. And Ryan is going to talk through the prevention programme and what it entails and how you can refer into it. But we thought we'd start off with a little quiz. So Ryan is going to share with you, it's a video quiz. There are about 6 questions and it's just a bit of fun. It's actually designed for doctors' waiting rooms. So you'll see that the answers are tailored towards your patients. But have a look and see actually how much do you know, and we'll get your response later.
Brilliant. Can everyone see my desktop at the moment? If a few people.
This is where we see if it can work.
Yeah.
Yes.
Yes, lovely. Hopefully the sound will work too. Difficulties with technology has come with me in 2021, so hopefully this will work. Let's have a look.
Thanks for that, Ryan. I wonder if you were expecting all of those answers or if any of them actually surprised you. What we're going to do now is we're going to talk through some slides, and please type in any questions you may have, and then we'll have hopefully a few minutes at the end to answer any questions. You may want to do that at the end or do it as you go along. It's entirely up to you. So I'm going to now share my screen with the present. I have a host disabled participant screen sharing. Is there any chance my screen?
Sorry, Philippa, I'll sort that now.
Thank you. I will just give you a few minutes to just go through your scores. If anyone wants to share what they scored in that quiz in the chat, that would be interesting. There's no shame or anything.
Philippa, you should be able to share your screen now.
Great, thank you. That looks like it. Perfect, thank you. So, as I said, we're going to be talking about the diabetes prevention programme, but I thought we'd start off by looking at what is the challenge in Lincolnshire and indeed the country. So the statistics are pretty alarming that 500 people a week with diabetes die prematurely in Britain, according to Diabetes UK. Now, obviously in COVID times, we're used to daily death statistics, but obviously 500 people a week, when it is 90% of it is actually preventable by lifestyle changes, is obviously an area that we could really do a lot of work through prevention measures. And a lot of the deaths are actually avoidable, but it's the complications of the diabetes. So if we drill down and look at what the stats are actually for Lincolnshire, so we have had new figures, but the figures for 2018 and 2019 showed that Lincolnshire's total diabetic population was 50,000 and a half, but about 4,000 of those were type 1. So approximately 46,000 type 2 diabetics in Lincolnshire. But if you look at the increase, that's the alarming part. So about 5,000 or so if you take out the type 1 population increase over 5 years. So on a yearly basis, that's approximately 1,000 type 2 and probably 141 or so type 1. So that's an alarming increase and something that we'd like to at least stabilise, if not decrease. Now we talk about complications in diabetes and they range all sorts. So this diagram just picks out a few of the main ones. Starting at the top left, the increased risk of dementia is a big problem, and we know that dementia affects your practices as people are getting older. But if we can delay the onset or prevent the onset of diabetes, obviously that's going to have an impact on your dementia statistics. It also doubles the risk of depression. So if you think how many of your patients come in presenting with diabetes and depression, obviously with the circulation, there's the doubling the risk of heart disease and stroke. And one area that we're going to look into in a little bit more detail shortly is the increased risk of complications in pregnancy. And we've been working with the Better Birth team, and I'll explain a little bit more about that because we've been looking into the statistics for Lincolnshire on that one. Also, there's increases risk of sexual dysfunction, not only for men, but also for women. Obviously, the increased likelihood of infections such as thrush that can cause problems with sexual dysfunction. And it is, of course, the major cause of nerve pain and damage. It leads to about 150 amputations every week, and you'll notice that in our quiz we had the statistic of, for 1 year, 53 major leg amputations, so that's amputations above the knee, but this stat here, 150 amputations, would include toes, feet, legs as well. With the kidney disease and kidney failure, that's another complication. And obviously another major one is it's a leading cause of sight loss and sight impairment. So as you can see, there are a wide range of complications. So it's a complex health condition. So what we've also learned recently is there is a link between type 2 diabetes and COVID. Now, obviously, it's too early to establish what that link is. Is it that they just share the same risk factors, or is it there's actually an element to the condition that makes you more vulnerable? So nationally, approximately a third of all the COVID patients who have passed away have actually had type 2 diabetes. In Lincolnshire, our latest figures would indicate it's approximately 28%. So, you know, very near that third statistics. So obviously at the moment, we recognise that practices and secondary care are run off their feet with COVID. So we, with the prevention programme, we've come up with ways to actually help save you time and bypass a lot of the system. So we can talk a bit about that later. But one of the positive things about COVID is what we're doing now is the use of digital work, and we've actually, Ryan will explain how we've incorporated that with the programme and how actually that has helped overcome some of our geographical problems that we've had in Lincolnshire in getting access to our patients. And we found that telephone and computer networks have really helped. And you'll also find that obviously over the last year, we've all had to change our habits. I think it's fair to say people have probably gone one of two ways. They've either increased their activity and lost weight, or a lot of people have gone the opposite way, which is fully understandable. So now is a good time to strike whilst the iron's hot and see what we can do. So I did mention that one of the areas that we have been looking at really closely recently was how diabetes has impacted in pregnancies. So there's two elements of this. There's women with an existing diagnosis of diabetes, whether it's type 1 or type 2, and there's women who develop gestational diabetes. So we were approached last year by Sue Jarvis in the Better Birth team, and she came to us and said that they had noticed that there had been an increase in the number of women giving birth with gestational diabetes. Would we like to help? So we welcomed that challenge, and she actually got some statistics together. So I'd like to share those with you. So what this table shows is the increase since 2016 to October 2020. So we didn't have the complete 2020 figures. So the increase in number of diabetic pregnancies. So if you look, you can see that in 2016 there were 318 in Lincolnshire. By October 2020, this figure had gone up to 923. Now, there's one thing I'd like to point out. You'll see that this is actually the pregnancies at ULHT, whereas what we've got to bear in mind that not all our mums actually give birth in Lincolnshire, so they may be registered in Lincolnshire, but obviously in the south, in the Boston area, a lot of them go to Peterborough City Hospital, and in the north, they may go to Scunthorpe. So this isn't actually the whole picture for Lincolnshire. So we actually think this could be a lot worse. Now, I did say that this includes type 1 pregnancies, but typically we'd be looking at maybe 1 or 2 type 1 pregnancies a month. So really the figures are predominantly gestational diabetes and type 2 diabetes. And where this is also important is when you consider the costs, the extra costs of this. So according to Better Birth, a standard birth pathway would be approximately £1,050, whereas a diabetic pathway is about £3,000 per patient. And this is based solely on the additional an additional time that they need for, I've forgotten the word now. Ryan will know, because when you have a scan, that's the word. So the additional scans that you need, and etc. So what that figure doesn't include is if you have a complicated birth. Now, where this becomes a problem is what we can look at is the stats that Ardens have produced. And what I've done here is I've pulled out 2 months. The earliest month that they looked at the statistics were April 19, and then the latest months were October 20. And the first one will includes insulin dependent mothers. Now, what I was rather surprised about is that, as I said earlier, you would expect that there are only about 1 or 2 per month of type 1. So one can infer from that, although it doesn't actually extrapolate the details, but you would estimate then that in October there were probably around 8 type 2 diabetic pregnant mothers. Now, in the past, we wouldn't necessarily associate type 2 diabetes until you're 40 plus, but we've now noticed that actually that age range is coming down significantly, and it would appear that our younger mums are in type 2 situation. And obviously the second line down, the non-insulin dependent ones, will all be type 2. So if you look in October, you could assume that there's approximately 14 or 15 would be type 2. And in April, it would probably be like 7. So there is a big increase, which we really need to keep an eye on. And then also the increase in gestational diabetes. Well, so we're not quite sure what is causing this big increase, but obviously obesity is a big factor. But if you look at the figures of 74 gestational diabetic mothers in April 19, and then that doubles up to 141 in October 20. So these are figures that we are looking into, because as you can see, they're alarming. So what you could do from practice point of view is keep an eye on your young mothers, speak to them before they get pregnant if you think that they may have significant risk factors, and please do refer them onto the programme where appropriate. So this statistic is considerably alarming, because what this deals with is non-delivery spells where diabetes is mentioned. So what this statistic includes is stillbirths and miscarriages. So if we look at the insulin dependent one, again, this is likely to include type 1, so 2 to 5, and non-insulin dependent 4 and 2. But what is quite alarming is the gestational diabetes pregnancies, which were 28 and then going up to 49. So in any event, we have in October 2020, we had 56 non-viable pregnancies where diabetes is mentioned. And that's not to say that diabetes was the sole cause, but what we do know is that the complications it causes does put the mother at risk, and more importantly, it puts the babies at risk. And where a baby does go full term, they're often very large babies, they're about 10 pounds, they're very pale, and that puts the baby at risk of developing complications. So as you can see, for mother and baby, it's an area that we really do wish to prevent where possible. So what have we achieved? One of the things that we've been looking at is concentrating on our Mablethorpe area, and Ryan and I were lucky enough to go along to Morisco practice last year. So Mablethorpe has a prevalence of about 14% type 2 diabetics, which was the highest in England, but has since lost its #1 slot. But if you put that in the context of the average was 6 to 7%, so it's approximately double the prevalence. And what we did was, this time last year, Ryan and I were successful in going into Mablethorpe and practice and sending out letters to a lot of their patients on the register, and we got an amazing uptake within 10 days. and more. We got over 80 patients who actually who signed up to self-referral and then joined the program. So that was a good success story. Unfortunately, we wanted to go back and follow that up, but COVID got in the way. So I mentioned amputations earlier, and my colleagues in the diabetes transformation team have been doing a lot on the diabetic pathway. And one of the things that they introduced was the vascular and orthopedic surgeons being introduced into foot clinics in Lincoln and Boston. And these direct referrals have led to an estimated quarter reduction to 25% reduction in amputations. So that's in 1920, that's an amazing 24 amputations. And as we were saying earlier, the implications of having an amputation are they're life-changing. They can affect your mobility, they can affect your economics, they can affect your mental health, and obviously a major amputation can even affect your life expectancy to approximately 5 years. So it's really important that we get the level of amputations down. And what my colleagues have done also is that they have introduced a lot of Eden training, which is open to you all, and that's being run remotely at the moment. They've made psychological support referrals available, and they've also improved the 3 treatment target results, which has a really positive impact. So that's what we've achieved so far. So if Ryan would like to take over and tell you all about how the programme itself works.
Thank you very much, Philippa. Ruth, can I just check, have I got 5 minutes or a little bit longer?
We've got about 5 minutes. I think we could probably run over a minute because we were late starting. So about 5, yeah.
I'm going to go through this very quickly then. So if you do want any more information, please contact me directly after your meeting today or your workshop today. That'd be brilliant. So first of all, before I let you know about our programme, I'm just going to cover the eligibility criteria. So in order for someone to be referred into the programme, they need to be 18 or over. They needed to be registered with the GP with the practice, and in their CCG area. They also require HbA1c or a FPG, a fasting plasma glucose, between the pre-diabetic ranges. So for HbA1c, it's 42 to 47. For fasting plasma glucose, it's between 5.5 and 6.9. Now, this criteria has changed a little bit because NHS England understood that COVID-19 was placing a lot of pressure on the primary care. So maybe people weren't having blood readings as frequently as they were prior to the pandemic hitting. So we can now accept readings which are up to 24 months old. That only used to be 12 months. So that's extended through now, which is great. And they cannot be pregnant to be referred on to the diabetes prevention programme. However, we've just had the announcement that we're actually rolling out a new referral route, which is called the GDM referral route. And essentially what that means is if someone's had or been diagnosed with gestational diabetes, and then after giving birth, they have a reading which is in the regular ranges for HbA1c or of FPG, they can actually be referred into the programme. So that's now coming into play from the 1st of February. So that's a new additional referral route that isn't included in that slide because it only got announced today, and that's why. So a bit about our service. So if you just press the next button along, please, that's all right. So we have a pathway throughout for the service users. So once they're referred into the programme, what we do is we perform an initial assessment. An initial assessment is a one-to-one review, find out a little bit about the service user and see whether or not they're eligible for the service. Once they're eligible for the service, we get them booked onto the group sessions, which comprise of nutritional information, physical activity information, and also behavioural change, which we'll talk about in a moment's time. And then we also have our end of programme review, and that's where we find out whether or not the programme was successful. And during this point as well, we like to find out whether or not they'd like to be signposted onto any of the services and what additional support we can put in place for the service users. Next slide, please, Philippa. So a little bit of a breakdown about the group sessions. So we have 5 eating well sessions, which are the nutritional based content. They're an hour and 15 minutes long with 30 minutes for questions. We have our physical activity sessions too, which are 4 in total. And that's focused around more moving more, not just exercise, because we understand moving more is much better than just undertaking exercise and be sedentary throughout the day. So we combine the both to try and encourage people to become more active through general activities throughout the day as opposed to just exercise alone. And we also have 4 take and charge sessions, which are based around behavioural change. So we try and put things in place to encourage people to make those correct changes to reduce the risk of becoming type 2 diabetic, or if they've made those changes, we put interventions in place for them which would help them maintain those changes that they've made throughout the programme. So that's a brief breakdown of the programme. If you wouldn't mind going next slide, please, Philippa. So service users have access to lots of different resources all the way throughout the programme. I'm not going to name all these because I've got 2 minutes left and I've got just a few more slides that I want to get through, but you get lots of different resources to support them make those changes to reduce the risk of becoming type 2 diabetic. And again, if you'd like to know more about each one of the resources that we hand out to service users, please do contact myself and Philippa and we can give you more information about that. Next slide, please, Philippa. So not to get confused with how we're doing things at the moment in time. So we are currently delivering our service remotely. So we was essentially a face-to-face service, but now we're delivering over either Microsoft Teams or over the phone, which is really good because it's made the program much more accessible. Because in certain instances, if you had a very rural area, low referrals, it could mean that a person was waiting for a particular group in that area for quite a while for the numbers to build up in order for us to put a diabetes prevention program on for those people. But now, because we're moving over to remote service, we're working nationally, so people from all different contracts that ICS hold for the diabetes prevention program can join a group together. So there isn't any waiting times at the moment, which is really good. So it's made it much more accessible, especially with the inclusion of over the phone, as well as Microsoft Teams as a way of delivering the session. But not to get confused with that way of delivering, which is the remote way of delivering, we also have a digital provider. Now the digital provider, the major difference between the remote program and also the digital program is the digital program is on a one-to-one basis and it's more one-to-one coaching as opposed to our remote service, which is more so in a group setting. So that's the difference. And our digital provider is Aviva. Again, if you want more information, please contact me afterwards. And just a bit of patient feedback. This is Simon, one of our service users that attended the program. This is Simon beforehand and after attending the program. It resulted in him losing 6 stone. And this is Simon, half the man he was from the beginning of the program, which it really does work, the service. So we do see really outstanding outcomes from people attending the service and reducing the risk of becoming type 2 diabetic. Next slides, please. I think we might skip this one, but again, this is a bit more feedback and we'll share these slides afterwards. So please do familiarise yourself with the feedback from the service users. Very quickly, have I got time, Ruth, just to mention these very quickly, just the referral routes?
In about 10 seconds.
Go for it, yeah.
So these are the referral routes into the service. So you can either perform a GP practice retrospective search, which essentially means you look at your list of people who are eligible for the programme by looking at their HbA1c or FPG readings. And similar to what we did at Morisco, you'd send out invitations to these people for them to then self-refer themselves into the service. The invitation stipulates the contact details for the provider and how to get in contact and so on. So that's embedded in your clinical systems at the moment in time. Alternatively, you can refer into the programme via an NHS health check, or you can also perform an opportunistic referral, which is a referral made by a healthcare professional or a GP during a consultation. So it may become apparent that during the consultation, a patient is eligible for the programme and they'll complete a referral form on their behalf and send that referral to the provider. We really do encourage you guys to perform a GP practice retrospective search because it is quite little admin time that's required and it's little input that's required from a healthcare professional. But once you send that invitation letter out to a patient, has our details on there, we can then triage that patient and get them booked onto the diabetes prevention programme. I think we might have to stop there. But any questions that we can help out with at the moment?
I do apologise for taking that all the time, Ryan, sorry.
No problem. Has anyone got any questions we could help answer?
Yeah, maybe everybody's ready for lunch.
That was really great. Thank you, Ryan and Philippa, and welcome back, those people who are joining us from the nurse breakout room. I'd suggest if you have got any questions from either of the breakout rooms, we will be sending around the details of all the speakers, but you can, of course, put them in the chat and we can try and get to them that way as well. Fabulous. Right, we're just going to let everybody back in the waiting room, just reconvene before we head off for lunch. I think we'll all be ready for it now. Okay. Just give everyone a few seconds. So have we got most people back now? Hannah, have we got you here? I think you were in the other breakout room.
Yeah, we're back.
Yeah, everybody's back in the room. Fantastic. Okay, I think you'll all agree it's been a really energizing morning, and what a wonderful surprise having Her Royal Highness join us. I've just checked her out on Twitter. She's got her own Twitter handle as Countess Style, so she's hopefully she might tweet something about us later. We've had some fantastic speakers so far. I've personally learned a lot, so I'm sure that you will have taken so much away too. I thought Karen's talk was just inspirational about giving you all the confidence to realise you are all leaders. And I think then Jackie echoed that, even just with her small, simple tip about how to encourage somebody to have a mammogram. That's leadership right there. She's changing lives and she's sharing her practice with you all. And hopefully you will all go on to share and put into practice some of the things Jackie shared with us. And of course we had the wonderful talk from Ryan, and I know there's been a lot of interest in the training that Ryan mentioned. So we're going to reconvene at 1 minute past quarter past one, so 1:14. So we want to start at 1:15 on the dot. So go off, have your lunch break. I'm going to challenge you all, when you have your lunch break and you eat your lunch, I want you to eat your lunch mindfully. So instead of shoving your lunch down your mouth and you haven't tasted a single mouthful because you're multitasking, I want you to mindfully eat your lunch and taste every mouthful and see.
Helen, sorry, just to interrupt, reconvening at 1 o'clock.
Yeah, oh, I do apologise. Yeah, it's whizzing by 1 o'clock. Okay, so 1 minute to 1. We will see you all. Have a lovely lunch.
Thank you.
So we are now going to head into some more breakout rooms. The last two that we did worked really, really well, and it's a great chance for you to network and see people's faces. So we've got 2 breakout rooms now for you to choose from. The first is childhood immunisation, and that's going to be run by Kerry Bennett, who's currently seconded as Deputy Head of Lincolnshire CCG's Health Protection and is the clinical lead for COVID vaccinations in Lincolnshire. And then we've got wound care. So wound care, you need to join on the separate link that's in the chat. And our wound care breakout room is going to be run today by Kelly Hutchinson, who's a clinical specialist at Ergo Medical, one of our other sponsors today. She has a background in wound management and tissue viability, and her specialist interest is in managing leg ulcers. So stay on the main meeting for the immunisation breakout room, follow the link in the chat for the wound care breakout room, and we'd like to have you back for 1:30 into the main room. Thank you.
Hi, Helen.
Hi there, is that Kerry?
It is, yeah.
Great, over to you, Kerry.
I didn't know, am I able to share my screen, or are we just, or can I control it?
Should be, Kerry, let me just check that.
Thanks.
Yeah, you should be able to share your screen.
Okay, great. I'm going to put my ugly face off. Which one is it? This one? No, this one. What can you see? Can you see it?
We can.
Excellent. Okay, right. So I'm going to have to be quite quick because I've got 23 slides to whisk through. So welcome everybody. I hope you're going to find this really interesting. I hope that you feel really empowered by the end of it to go and find out what's going on in your own practice around childhood immunisation uptake. Helen will be looking in the chat box for me. Because I've got some questions. I've got a bit of a quiz, 5 questions for you, just to get the old brains going after post-lunch. thank you very much for inviting me. I must say thank you to Lincolnshire Hub for inviting me. For those of you that know me, I'm not a general practice nurse, so I don't know all the answers, but I can find out. And I've laid the presentation out in a bit of an SBAR format, so situation, background, assessment and recommendations. So hopefully you can find it quite logical. It's quite top heavy with data. Hopefully as well, you can look at this in your own time because I will be going quite quickly through it. I don't have all the answers. I'm not going to talk about why children are not being brought in. Because I think, you know, there's lots of questions and there's lots of reasons for that. But anyway, we'll start. So, can't move that. Okay, right. So I've put this together to present to yourselves. I've presented a similar presentation to clinical leads, so the GP partners. It's gone to executives as well, and it's also gone to the Lincolnshire Immunisation Board. All the information that you get is from is as up to date as I can get it. So that's up to November of last year. And I know that in the summer of July last year, we did highlight, this was, you guys got a letter highlighting the need just to address how we can improve immunisations, because we did see it drop off during COVID. So we're going to talk about it regionally, by locality, by PCN and practice levels. Okay, so quiz. Okay, so got 5 questions then. So Helen, I need you to read them out to me because we're not going to spend too much time. Currently, regionally, which STP is the best performing with childhood immunisations? So is it A, Leicester, Leicestershire and Rutland STP, B, Lincolnshire or C, Derbyshire?
Fastest fingers first.
Fastest fingers, so read them out to me.
We've not got any coming through just yet. I'm going to say B, Lincolnshire.
I'm going to say Lincolnshire.
So sadly not. It is A, is Leicestershire, Leicester and Rutland STP. So they are approximately, their uptake for childhood immunisation, so this is from the 0 to 5-year-old age group, remember, is about 95 to 97% uptake. And remember that we want to achieve herd immunity of 95% and more. So which is the worst performing with childhood immunisations? So same regions, A, Leicestershire, B, Lincolnshire or C, Derbyshire.
So we've got a bit of a mix coming through, but quite a few C's coming through.
So sadly, it is us. So we're the worst performing when it comes to childhood IMS. But what I want to say about that, so that's approximately across the county, we've got an uptake of 90 to 92%. So remembering we want to get up to 95%, so quite a little bit behind. However, from a flu point of view, you guys are absolutely blowing it out of the park. And I must say very much thank you for all your hard work around the flu programme. I hope that you got all my thanks that came through to you on various different medias. I know it did appear on South and Southwest Facebook page, but you really were absolutely fantastic, phenomenal performance for our region. So well done. But however, we need to work a little bit harder with childhood IMS. So question 3, approximately how many unvaccinated children have we got? 0 to 5 are in Lincolnshire. And that is to the end of November. So my data is up to November. So it'll be a little bit more. So 500, 1,500 or 3,000.
Okay, we've got some 3,000s coming through, a couple of lots for 3,000s.
So no, not as many as 3,000. B, 1,500. And then question 4, which childhood immunisation has the worst uptake, do you think? A, rotavirus, B, MMR at 2 or C, MMR booster?
So lots of C's.
Yes, lots of C's. So yeah, we're about 87% approximately. So quite below target. Okay, so 5, how many more times infectious is measles than COVID-19? So do we think it's 12 times, twice as infectious, or 6 times as infectious?
That's a tricky one. So we've got, yeah, got some C's, an A. Somebody's asked, depends which strain. An A. So no B's, but some C's and some A's.
So approximately 6 times. So of course, COVID-19 is incredibly important at the moment, and that all our focus is in that. But when we think about outbreaks, and in the past, Lincolnshire has not had any outbreaks, but we have been surrounded as a county by pockets of outbreaks. Okay, so that's the quiz over with. So B for background then. So what is happening regionally and nationally? And hopefully you can see those slides. I've just done a comparison of year-old IMS and then at 5. And you can see that the solid blue line is Lincolnshire. The broken black line is the Midlands, so us as a region, and where we are is a faint grey line is England. And so you can see that we are quite below where we need to be, especially when we look across at the MMR coverage. This is just a little map for you that Lincolnshire County Council gave me. I think it's a really good visual map. It shows where the deprivation is. It shows where your GP practices is. It shows where your PCN boundaries are and your PCNs that come under the practices now. So we see a lot of deprivation over on the East Coast, under the coastal and Solus PCN. We see, you know, it goes lighter towards East Lindsey and Boston, and then South Lincolnshire PCN. Also, this little blue bit around here is Gainsborough, a little bit of blue in the middle where Lincoln is. And we'll come back to that map. So A for assessment then. So what are the headlines from April to November? So we talked about how many approximately unvaccinated children we have. Obviously that number will be, that rolling number will be a bit more, and that equates to 10% of cohorts. Now, although of course we want to vaccinate 100%, of course we do. But when you actually look at these numbers and you break it down, to get up to 95% herd immunity, we're talking about vaccinating 700 children. So not large numbers. When you split that across the county, you split that down into PCNs, and then you split that down to practice level again. Worst uptake though, county-wide, question mark I put there because at the moment we're just querying the pneumococcal data for 1-year-olds that's come through. You'll see that in a minute, some odd numbers. So we think that might be a bit of a data quality issue. Pneumococcal for 2-year-olds, 2-year-olds. Is that 6 in 1, 5 in 1 booster for 5-year-olds, and your MMR booster for 5-year-olds that we talked about earlier. We will see different rates locally, and that does show a differing picture, which is quite interesting. When we talk about PCNs, K2, Sleaford area, 4 counties, which is sort of Bourne and Stamford, are achieving herd immunity for 1-year-olds. South Lincoln achieve herd immunity for 2-year-olds with Apex and IMP, so that's big up for the West. No PCN is achieving total herd immunity for all 5-year-old immunisations. Apex, again, West. South rural Lincolnshire, very interesting because that is sort of a high deprivation area. K2 and 4 counties are best performing with 5-year-old IMS. MMR booster for 5-year-olds is consistently poor across all PCNs, but not necessarily at practice level. That's just a slide just to show you what the definitions are for what counts as sort of a mark on the dashboard. So what's a completed immunisation? So for example, you've got to have 2 doses of your rotavirus for it to show in the data. Okay, so when we look at it locality PCN wise, this is up to November, remember. I've just highlighted in yellow some of the areas that are doing well, some that are not doing so well. it is flashed in green if it's 95% and above, because that's what we're aiming for. So you can see when you look at locality, east locality is not doing so well, southwest is doing a lot better. Quite different numbers in the cohorts though. When we look at the PCNs overall, Boston, so thinking back to when that map was, Boston isn't doing so well. Interesting compared to the coastal areas. You've got Apex, Imp, South Lincoln, all doing really well in the west. K2, 4 counties, and South Rural again. That just goes back to the map again. So you possibly might have thought that First Coastal and Solus wouldn't have had such a good uptake compared to Boston. So Boston not doing so well. And again, we've got not far away from each other, lots of areas of deprivation here. South Lincolnshire really doing well. And that's, I'm not so good at where everything is. So I just put that up just to show you exactly where the areas are. If you just if you were to cut out this bit above here, it's not that's not part of our area, North Lincolnshire, but this is that dark blue bit is the Gainsborough area. And then we've got the coastal area here, which is the dark blue bit. Okay, so when we talk about unvaccinated numbers, really interesting here. So unvaccinated numbers, do you think that's a lot? Questions, comments, please. What do you think to that? Ignore this column, ignore that one there, because we think that's a bit of a data quality blip. When you break it down to PCNs, remember we're breaking it down to practices as well, not big numbers. Have you got any comments on that?
So there's nothing in the chat at the moment.
That's fine. I just wondered if people were thought, crikey, actually, that's not as bad as I thought.
And if anybody did want to unmute just to add their comments, please feel free to do
Yeah,
that.
please do. So we take Boston, for example, and we look across there for unvaccinated numbers. There are this sort of six practices within that group. Okay, so let's go on to the next slide then. So if we talk about it now at practice level. So practice comparison. So east locality. So big up for swine's head surgery. I've just sort of highlighted that one there. So we talked about the east not doing so well. So how are you guys sort of sharing all this good practice? What is it that you're doing that's so good? How, and how are you sharing that as a locality? West. Moving on to west locality. This is very interesting. We've got Birchwood here. Lots of deprivation in Birchwood area. If we've got practice nurse from Birchwood, what is it you're doing? Put it in the chat, because you're obviously doing great things. Well done. Richmond doing really great things. Minster medical practice. Then we've got Marina, smaller numbers here, not doing so well. And of course, smaller numbers will sometimes mean, for example, University Health Centre here that's got just 3 children for this cohort of 2-year-olds. Then if they don't get those children vaccinated, then obviously it will show up as a sort of a lower percentage. I know that the GPs from this area were really interested when I presented this recently. They took this away and said, thanks, Kerry, we didn't realise. Going on to Southwest, big up to Sleaford Medical Group. So, again, large numbers here and doing really good stuff. Lots of green in Southwest. When you look at so I just wanted to sort of give you an example. There's about 6 practices in Grantham area. I just looked at St John's, because St John's has got some large numbers there. They don't actually need to vaccinate. I mean, again, obviously we want all children vaccinated, but obviously some people, some families are difficult to get that uptake, even with all the counselling that you take them through. But to get St John's up to 95%, so up to herd immunity for 1-year-old, approximately 1 child would need to be vaccinated in this group. approximately 4 children would need to be immunised to get this up to herd immunity, and approximately 8 children more in the 5-year-old category. So I hope you can see where I'm coming from. So South locality then, Hereward, Long Sutton, doing great things. Long Sutton, again, really deprived area, doing some great things. Shout out to Long Sutton. What is it? If you're in the chat, tell us, share all this good info, all this good practice that you're doing. And I highlighted Hereward as well, because we've got Hereward and Bourne Galilee, in the same town, quite different figures here, quite different, similar numbers, different uptake. So recommendations then, we're nearly there, guys. Hang on there, hang in there. So some really, really good work that you are doing. Fantastic. But we need to share it. And I suppose these are my next steps. I've been completely sort of engrossed by COVID, as we all are. So I really need to sort of find out in these different areas, what is it you're doing differently? Look at your practice data.
We've had somebody share, just to interrupt, if you want me to read it out for you, it's probably a good moment. So
yeah,
Heather's shared, she's from Birchwood Practice.
Excellent.
She doesn't take any credit as our
Well done.
child IMS nurse contacts each family that are hard to reach and encourages appointments to be booked. If they DNA, she phones and writes them, and she doesn't let go until she's done.
Excellent. That's really great. Really great. Thank you. Keep up the good work. So yeah, so look at your practice data, work out. I mean, again, we want 100% here, but we do realise that sort of 2% normally, you know, you're going to get 2% refusal rate. Work out how many children you need to vaccinate to get up to this herd immunity. So when we talk about best practice and nice, I forgot, I meant to put a link here, but I did forget, so apologies. What does that say? It says adopt a multifaceted, coordinated approach, identified professional, access to your green book, look at your service and tailor it if possible. Training and IT systems, target your risk groups like Birchwood are doing, and your health visitor input. Best practice then. So 6 focus areas to improve, optimize uptake. So strong leadership, you know, nurses are the best at this. This is your bread and butter. Who's leading your practice on IMS? Is there an individual? Contractually, there should be now. Is this discussed at practice meetings? And if it is it a standing agenda item? Should it be at PCN level? 2, proactive promotion. How are you reviewing your IMS data? How are you promoting it? How are you saying to your practice, to your parents, actually, I know we're saying stay at home, but you still need to bring your children in for their IMS. Maintaining accurate information. How are you advertising this to GPs? I've lost my thread a little bit. Effective recall and call, number 4. How effective is it? How do you discuss children that are not being brought? How are you discussing it with your health visitors? 5, maximising access and continuity. How are you ensuring that parents have access at all times? Do you opportunistically vaccinate? 6, trained and knowledgeable workforce. We know within the NHS that we do have a quick staff turnover sometimes, and how are you ensuring that staff are trained and up to date? And finally, what are the needs of your local population? So one size does not fit all. Reasons for non-attending, child not brought. What could the barriers to the access be? Look at your specific groups. So I know that you had was it Jackie that was talking earlier about LD? So do they have a learning disability? Parents, are they able to read? Informal carer, looked after children. I talked about COVID. Practices are still open. How do parents know to bring their children still? Hopefully they're still getting their invites from the central, from NHSEI. How can my practice improve access to services, engage communities, target specific groups? So next steps really are looking at, which practice is doing well, speaking to the health visitors teams. We probably need to get a really good comms strategy. I'd really like anybody that wants to be involved in a comms strategy, a little video from your practice saying, we're still open, please bring your children, and all those extra kind of health messages. Contractually, all practices must have a named lead. You must also ensure that your staff are trained, have timely appointments. We talked about call and recall. And that's it, really. Any questions? I've used that last slide because I'm not really entirely sure whether that child is actually being vaccinated, that baby. Looks too happy.
Does look happy. Thank you so much.
And so that's me.
Thank you, Kerry. Somebody's made the point, and I'll let people write their questions as in the last 30 seconds. Somebody's made the point, unfortunately, health visitors do not have anything to do with children not brought in for IMS. So,
okay. So that's really interesting. I'm going to be meeting with the health visitor lead, Linda Dennett, because we all need to work sort of as a system together.
Kerry, I made that comment because obviously I work in the centre of Lincoln, and so our immunisation uptake because of deprivation, etc., families that don't speak English as a first language, so we have a high not brought in for immunisations. So historically, we always used to task the health visitor to make them aware, but sort of like their capacity, it's very low on their priority, and they don't help with sort of speaking to families.
And I think this is we probably need to revisit this, Lisa, because it may be that we need to do some targeted work. Because, as I said, not one size does not fit all. And I kind of think that if we can get a COVID vaccination programme up and running across the county in less than 8 weeks, we can absolutely get childhood immunisations up and running. If we can get a roving model where you've got vaccination teams going across vaccinating vulnerable groups, then why can't we do that for children? So I think there's a lot more work to be done, and I certainly don't have all the answers, but health visitors do absolutely play a really, really crucial part, and I think it's how GPNs and health visitors work together, identifying those tricky groups.
Thank you, and that's great that Lisa's been able to raise that, because it sounds like some work going forward might come from that. Thank you. So thank you so much, Kerry, and thank you to all those joining us from the other breakout rooms who were in with Kelly. I think most people are back with us now. If you're back from the other breakout room, can you just pop yes in the chat so I know that it's closed? So anyone that's come from the alternative breakout room.
I think from the numbers, Helen, we're still waiting on people to rejoin us.
Okay, fine. We'll give them a few minutes then. We could have let Kerry and Lisa speak a bit longer, couldn't we? Are you still here, Kerry, while we're waiting for everybody else to rejoin us?
I am indeed.
Somebody's made the point that we need to work with social media.
Yes, we do. So let's contact me. I'm available, kerry.bennett@nhs.net, not to do any media, but certainly if somebody wants to be part of a video that we can get on all social platforms. I've spoken to Lincolnshire County Council. They're very, very enthusiastic about getting some information out there, and certainly NHSEI's information is quite old now, so we do need to do something locally. So any volunteers, anybody that wants to put themselves forward, please contact me. But I don't think it's not, for me, it's not unachievable when you're thinking about the large numbers around the flu cohorts and the extra cohorts that practices have had to vaccinate this year. And as I say, Lincolnshire has just blown that completely out of the water. I mean, the uptake has been fantastic. So we know that it can be done, and obviously it is a lot more tricky, and I am not a specialist I'm not a general practice nurse, but there are, if you can do that, you can certainly, there are ways of improving uptake, especially when herd immunity is quite low. And hopefully I demonstrated that those unvaccinated, those numbers aren't really very big at all. So it is within our grasp to achieve.
Wonderful. Thank you, Kerry. And Kimberly's just said she's going to dip in out as she's vaccinating at the showground. So thank you so much, Kimberly,
Excellent,
for managing to join us whilst doing that. Okay,
brilliant.
I think we've got everybody back now. So thank you so much for that, Kerry, and thank you all for rejoining us. So we're going to go over to our next session, which I am so excited about. I can see some people starting to get a little bit sort of post-lunch fatigue. So I'm going to ask you to stand up again. I said there will be lots of standing. Up you come, have a little walk on the spot. Ewan, I can see you. Up you come, Ewan. Now I want you to follow me. Take your arms up. Big deep breath in. And then down. Big deep breath out. Well done. Well done. You've just activated your parasympathetic mode there, which will help you to take things in. So you can sit back down if you wish. If you want to stay standing, fantastic. And now we are going to hand over to Rebecca Howard, who I've seen just join us. So Rebecca is here to introduce the Shiny Mind app. It is fantastic. I have this app. I use it every day. Rebecca's a psychotherapist and an executive coach with over 17 years experience working in leadership development in the NHS in the fields of resilience, confidence, performance, compassion, amongst many others, all of the things that we all really need right now. So I'm going to hand over to Rebecca.
Thank you, Helen, and for such a lovely intro. And it is so wonderful to be with you guys today for lots of different reasons, to talk about the Shiny Mind app and how it's going to help resilience, and how you guys are all going to be able to have access to it today, which is so super exciting. But more importantly, and for me, is that you are all in my home county of Lincolnshire. So looking and just hearing Kerry and talking about all those practices, I was just thinking, this is my home. So it is so good to be here today. So I have some slides that I'm just going to share with you, and hopefully I'm on a co-host so I can do this, Ruth. Ruth is nodding at me, because what I want to do is just talk you through the why this is so important and why we created it and how it's going to help you. So hopefully if I share this, you can see a cup. Can you see a cup, everybody? Yes, that is why we're here, because we cannot pour from an empty cup. And you will have heard this. But the reality in this room, and there are so many of you doing such an amazing job keeping primary care together, the heart of primary care is that so many of us are trying to do our jobs with very little in our cup. And the reality is that if we were to turn that cup over, for some, there would be a trickle, and for some, there would be hardly anything in the cup at all. So that gives us the question. So how can we help build the flow up, build the level up of this cup in a year that has been like a year and plus a year that we have never seen the like of? When the things that kept us well, seeing people and being able to go and do things, the bits that kept our hope going, kept our resilience going, are different. Everything is different. Where a week feels like a month and a month feels like a year. How do we do that? How do we help ourselves to help each other to be there for our patients? And that's the reason we're here. And that's the reason why I'm in this room, is because this is a subject matter that I've been working on for years and years and years, and helped. And our approach from a leadership psychotherapist point of view is different in terms of helping people feel resilient, build their personal resilience up, be able to look after their well-being and create a loci of control. And that work started with creating a mindset, a resilience mindset program in 2015. And we've worked with so many people in the NHS, in fact, exclusively within the NHS, to help them think better, to feel better, to be better. And that's the premise of our work, because one of my mantras is our thinking. The most important relationship any of us will have in this room is with our own mind and body, because it absolutely affects every single interaction you will ever have in your life. But so many of us perhaps don't spend so much time on that relationship, or don't treat it so well, the relationship with our mind. In fact, people spend longer learning how to drive than they do learning how to think. And so this mindset program was all about helping people learn how to think so they could feel better. And it worked. With over 2,500 people coming through the program, only 6 people said they wouldn't recommend it. And in the 90% were people who said they felt better, felt less stressed, felt more resilient. So then the call to action for us, and our passion has been over the last few years, how do we help more people? And so we sat with the NHS in Liverpool, and we said, and we decided to create an app. And we said, what will make you feel better? How can we help? What do you need? What works? What doesn't work? And we spent a year with the NHS saying, what do you want? And then we spent a year building it. So this app is your app. It's the NHS's app. And I am so proud today to be able to say that you guys, this community, are going to be invested in, because Link CCG care so much about you to keep you guys well. So let us just talk about some of that co-production work that actually helps you understand what's on this app and why it does work. Well, when we asked everybody, and we asked so many people in the NHS what would help, you know, from porters to CEOs, everybody, all walks of life, people at different life stages, people who are starting a career, people who are retiring, people who are looking after elderly parents, people who had a long-term illness, people who are getting married, people getting divorced. The whole of life was in this co-design process. And we said, what do you want? And they were clear. They said, we do not want an app that is passive, something that, you know, what Jackie gets is the same as what Ruth gets. We want to interact with this app, and we know ourselves well enough that if we're given the tools, we can learn more about our responses, our emotions, how we feel, so we can have our loci of control. We can be in control. So we built an interactive app, and it builds as a personal resource for you as you work through it. So we have a ton of masterclasses. There's 100+ exercises that you can do to understand yourself. Because remember, if we understand us, we know how we interact, we know when it goes wrong, and we can manage it and manage ourselves. So there's loads of stuff on here, from sleep, because let's face it, when we're stressed, sleep goes out the window. So there is sleep in here to help you. There are meditations. There are learning, how do I think on bad days? My thinking goes all over the place. How do I get back into control to feel better? All of this is in here, plus the original resilience program. And the other thing they said to us, and I'm sure this means this is the same for you, we don't have oodles of time. We are time poor. So does anybody recognize being time poor? Is we just don't have enough time. So we're saying if we're going to go onto an app, we want it to be speedy, and we want to know that it'll work. And that's why you can see here the science button. There is nothing on the app that isn't evidence and research-based, which shows that if you invest your time, which is so precious, is that it will help you, and you can find out the why. So that is there too. But a really powerful exercise I wanted to draw your attention to today, which is one you could start doing today, even before you get the app, is what went well. When things are tricky, we lose our perspective and our emotion goes down. We feel worse. This simple exercise by Martin Seligman, who's the father of positive psychology, is every day, just ask yourself 3 things. What went well today? I am not looking for you to create groundbreaking stuff like I got a promotion or whatever it may be. You know, for me, it is simply I didn't eat chocolate for lunch, which I shouldn't say to anybody here because you'll probably switch me off completely. But I didn't eat chocolate for lunch. You know, simple things. You know, I actually went for a walk at lunchtime instead. They don't have to be big things, but recording them on the app actually means you can go back and it alters your perspective and helps us be more buoyant. So the next thing they asked us for was they knew that actually the only way that they were going to get through, this is the whole of the NHS said this to us, was together. Healthcare is everyone's business. Everyone plays a part. And this was pre-COVID, so goodness knows what you guys would tell me today, but it's a team. And they wanted to be able to be connected with each other, to support each other, to say thanks. So they wanted this community to be filled with kindness and positivity. And so that's what we built. And that is what's going to happen for you guys in Links today, is we are building a community of those people, your profession, that hold primary care together. Everybody in that profession, in that professional space, can come on and be created as a community. So actually what the app allows you to do is send positivity posts to each other. So when somebody's helped you out in your team, you can say thanks. And you can say what you're grateful for. And what this does is it absolutely helps people feel purpose, belonging, and connection. And we see it time and time again when people get a post in the morning, their mood lifts and they feel so, so much better. And we know that people are not a shift pattern. They're not just work. You're not a 9-to-5 person, or if only the hours were those. You are a whole person. And so therefore the messaging and the way that you can create these wonderful positivity posts or shout outs, which are like little cards that you can send people, you can send across social media. So they connect to your WhatsApp, they connect to your Instagram, they connect to Twitter and Facebook. So you can connect with those that matter to you, those that maybe you haven't seen for a while, and you can support them. Because the thing about this community is at the heart of it is kindness. And kindness is a superpower, because however you experience kindness, it lifts us. Whether I give it by sending a positivity post to my colleague and saying thanks, when they reply and say thanks to me, it lifts me. And also, in terms of just witnessing teams do this, because that's what we see, teams support each other in this messaging. All of it makes a difference. We've also got something which is really nursing specific, is nurses asked us, we like inspirational quotes. I did not know this. And we like them because they lift us and we share them around our community and our connection. So we have Inspire Me, which is every day an inspirational quote will pop into your app, and you don't have to just keep it, because equally you can share it out with your wider social networks. But the thing is, we need to move into that place where we can be compassionate to self, because that is the only way, by being kind to us, we fill that cup up. And this is the deal, we're not good at it. We're 75% more compassionate to others than we are to ourselves. And that's a problem if we've got to look after our cup, because you guys are so good at helping others that actually all of the resources go to that rather than to us. And this was a factor, common factor. So what did we want to do? This was our aim. We wanted to help people understand that self-compassion is turning to yourself and saying, I've got your back. Actually turning all of that good stuff you give to patients, but actually using that portable 24/7 resource and bringing it back to self, being your own best friend. And that's how the app was built. So how are we going to stimulate that? We wanted to make it simple, because you again have not got much time. So we created the Daily Shine. The Daily Shine is a way to keep us shiny, to keep us well, so we can be there for others. It's a 5-step activity. It takes 5 minutes. Could we all give ourselves 5 minutes? I'm sure we could, because without us, there isn't a healthcare system. So this Daily Shine is made up of the first part, which is understanding how we feel. Our feelings and our thoughts are so autopilot that very often we end up not feeling so well, and we don't even know where the thoughts come from. So this daily practice is to check in and go, how am I doing? How am I doing? If I'm going to turn to myself and say, I've got your back, look after me, how am I doing? And the science behind this is when you click these smiley faces and then decide what actually the mood, the emotion correlates to, is this in itself, the science says by doing this, it reduces the amygdala response. It engages your prefrontal, I can't even say it, it's so exciting, prefrontal cortex, which actually means we regulate ourselves back. And then if we write about it, this is journaling. The science says, now get this, if you journal, you live longer. And you kind of think, why on earth would we not all want to do that? So we journal it and we live longer. But then what do you do with what you find? Well, this is the interesting thing, which again, science helps us here in terms of Brinell and Gasco research, which is done in Madrid and Ohio, found that humans think of thoughts as real things. They're not, but we act on them as they're physical, real things. So when you've journaled and you've understood how you're feeling and why, what do you do with it? Well, if you store it because you found something useful that you want to go back to and go, that's how I coped with this. This is what I found out about me. You will then feel like you've got a physical resource. But if it's something you want to let go of, press the wash away button and water will come across the screen and it will just disappear. And cognitively, it disappears also. Simple, but so effective and so easy to do in 5 minutes. It then follows on with breathing. And we've got an animated breathing exercise that actually helps you understand how to breathe. Now, you guys might know how to do that. But in 1 minute, box breathing can help you, give you the focus and the energy that Navy SEALs have. And then we move to gratitude, sharing gratitude and expressing gratitude. Again, makes us more optimistic, helps us feel more positive. And then kind sight to kick into self-compassion, ideas to be kind to you and to kind to others. And then connection, the last step, to actually help support your community and your colleagues by sending them that positivity message so they feel supported by you. And then it will give you, because you've put your mood in, it'll give you an exercise that will help you in that moment, should you wish to. But I'm not unrealistic. This time is ridiculously pressured. I can't even imagine what you are up against in terms of all the IMS and VACs that Kerry was talking about, but COVID and everything else, plus your home lives. You know, it's not easy. There isn't anybody in this room that hasn't had a degree of struggle that would be a falsehood through this period. And that was a reality of the co-design stuff. We needed to help people when they needed it most. So we created an SOS button, which is full of 5-minute bite-sized things that can get you back into a place where you feel in control and better. So once you press it, you get all these choices, the emotions traffic light to actually help you make sense of the emotions and get them to regulate and calm. Because if we act from an emotional place, sometimes we can get ourselves into trouble. And this app is holistic. So I'm not talking just work, I'm talking home. I'm talking all of those other personal relationships, which if you're anything like me, have been stretched to the limit this year. Have they not? Maybe not for you. And then the coping well is, if you go into the coping well, you can dig out under things like even losing weight, stress, dealing with difficult people. They have lots of bite-sized ideas. And stress, one of the ones is to do with when we feel stressed, we produce less saliva. So chew gum, because it creates more saliva and it tricks your brain and actually calms you. Simple, simple techniques. But let me tell you about the mood bath, which is actually one of my personal favorites and a favorite for many, many people, is we have, the University of Melbourne found out that we have a thing as humans called biophilia. And we love being in nature, quite frankly. All walks in nature make us feel better. And yet, but sometimes in the middle of the night, in the middle of a shift, with a difficult patient, with a stressful day, with a stressful argument at home, we may not be able to walk in a wood. But actually, mood baths enable you to immerse yourself in nature, the sound and the visual. And you can choose from calming lake to crickets to bird song to warming fire to waves. And within 40 seconds, your heart rate will regulate, your stress levels will come down. And that's what the science says. But actually, on our website at the moment and in the Empathy Museum, Rabana Hussein-Males, who's a GPN from Nottingham, actually created her own way of talking about the app, unbeknown to us, to say that what got her through COVID was being able to listen to the waves every day, just to remind her that good times, holidays were coming. Those good times with kids would come back. She was shielding. She felt disappointed she couldn't be there to help her colleagues, and it kept her through. So simple things make the biggest difference. We've done some research, which is probably why the lovely Links CCG wanted to bring the app in, because it works. We did this research through COVID, and 100% of people, which is hard to get, said they actually really felt it was helping them. 90% felt more positive and motivated, which is quite hard to believe given the pressure that you guys are under, but they did. And then this is what they tell their colleague about what the app is. And for me, my favorite is, it is a hug in an app. A hug for me and a hug for my colleagues, because I connect with them and I can support them. And those that did the Resilience Mindset program, which was our original starting point, have even gone and done some amazing things like compete in runs, which I guess they clearly did when we could. But this just gives you an idea of what the app can do for you. So as this app has now come to you and launched today, my invitation to you is, get in touch with Ruth Pollock, who will let you know her details, I am sure, and send her your name and your email address, because that's all she needs to send you your login. So you can become part of this wonderful community in Lincolnshire. But there will be people, let's be honest, on this call that go, yeah, I absolutely could do with that. That would help me with my sleep. I can obviously get it and I can see it. And there will be people that are struggling that will go, Ruth, can you get this to me as soon as possible? And she will. But then for the other people that are going, I'm doing fine. I'm actually doing really good. I'm really pleased that you are, but we so need you on that community too, because it is your energy and positivity that will help your colleagues connect. And actually, by sending them those messages, by saying thank you, instead of your colleagues' heads starting to go down and finding them when it's too late, if you're doing well, actively being involved in the community, bringing your colleagues across Lincolnshire within your profession and telling them about this, because you're not all on this call, will help them know how they can get this support and how you as a community, the heart of primary care, can actually keep yourself well, each other well, so you can be there for patients. And it's a big, big thank you to me and Link CCG, Susan and Ruth and all the gang for inviting me here today, Helen for chairing. I miss the Countess of Wessex, but I am proud of my county and I am so super proud to be here today to share this. And I so hope it helps you. And I know the NHS would be saying a huge thank you to everything that you are doing, because without you, healthcare would not exist. Thank you.
Thank you so much, Rebecca. That was just wonderful. And as I say, I use this app. I think it's fantastic. And all of the things that Rebecca said, all evidence-based, connection and sharing and positivity and gratitude and nature, just fantastic evidence-based actions that we can all take, that the app just helps us and prompts us to do and gives us the science behind it. Ruth's going to send out an email with the details. I don't know if you're still there, Rebecca. Very quickly, there was just a question about data, about how the data is stored. Is any information on the app stored centrally, was the question.
No, anything you input on the app is confidential. It's all compliant with GDPR and all the good things you would expect any NHS body to do, but nobody can see anything that you input onto the app. It's all confidential, encrypted, like any message you would ever send. Fantastic. So go for it. It's your personal place
Wonderful, thank you. So we're now going to have a short break, go off, do something that brings you joy, have a walk around, have a stretch, connect with a colleague, stroke your dog, give your child a hug, do something that's going to fill up your tank a little bit more today, and we'll see you back here at 2:05 for the awards ceremony. Welcome back, everybody. It's now 5 past. I can't actually see everybody anymore because the spotlight is now on me. So if you are back, does somebody want to just write yes in the chat so I know I'm not talking to myself? Ah, fantastic. You're all back. Wonderful. Okay, so we're now going to move on to the highlight of the day, which is our awards ceremony. We know that when we tell people we are thankful and grateful for them, and when we acknowledge when people have done well, it has hugely positive effects on our well-being. So even tiny things such as, for example, Lisa, when I saw you deal with that patient this morning, you did wonderfully. Or Ruth, when you smiled at me this morning, it really brightened up my day. So feeding back to people when they've done something positive and done something well has massive protective effects on our well-being. So what better way for us to do this today than with our awards ceremony? So I'm going to hand over to Susan and Ruth from the Training Hub, who are going to take us forward with the awards. Thank you.
Thanks, Helen. I think we're actually going to slot the Training Hub presentation in just briefly before the awards.
Fabulous.
We had to shuffle around this morning because of our special guest, which nobody has got any issues with. So just hang fire for the awards if you don't mind, and we'll just quickly do our presentation with regards to further opportunities for yourselves and your practices. So I'm presenting this today along with our Director of Nursing, Lisa Freeman, Caroline Clay and Hannah Daniel, who are both of our lead nurses across the locality. Next slide, please. Okay, who we are and what we do as a training hub. We are a team of GPs, nurses and business project managers working in general practice across Lincolnshire. Our vision is to grow a dynamic, sustainable Lincolnshire workforce through education and primary care and to accelerate clinical excellence. Our mission is to build authentic relationships and work collaboratively to develop the primary care workforce. And training hubs contribute to development and retention of the workforce through delivery of locally commissioned initiatives. Next slide, please. Okay, I'll pass you on to Caroline.
Okay, so what have we been up to this last year? Lots of things. As you can see, we've actually delivered over 340 funded places on courses that have been requested by you. We are driven by your needs. I mean, obviously you've been involved in our training needs analysis that we did. You know, we will continue to be steered by you in terms of trying to get the courses you need to make sure you become, that you play to the top of your game in practice nursing. We're also doing support to new general practice nurses and nursing associates. You know, we've started our preceptorship programs for both of these. And also we've upskilled 6 healthcare assistants onto the nursing associate courses, and obviously supported many more of you with the chronic disease courses, IM skills, lots of things, and we will continue to do so. Next slide, please. I think I'll continue, I guess. Opportunities for you. As we've said previously, there are some CPD monies available to you. That's £333 per year for all nurses. There are also funded training courses for, I'm just going to hide my video panel, all funded training courses at all levels. So advanced clinical practice, chronic disease, triage for administrators and everything, as well as minor surgery and lots more. If you do decide to bring a student nurse into practice, we will support you no matter what it is. We will do our best to help. We're also working on a project around apprenticeships for nursing associates. As we said before, the preceptorship, 2-year preceptorship for newly qualified practice nurses, and also retraining support for the wider nursing team as well, and recruiting there. We're also planning, I think, in February to launch a career check-in system as well. So you can contact the hub and talk to us, you know, and go through your ideas in terms of what you'd like to do career-wise and how we may be able to support you in your endeavours in that regard. Next slide.
So the way that you can access our opportunities with the Lincolnshire Training Hub, it is fairly straightforward. So what we do is we have a website, which we can send out to you, so you've got the contact details for us. But whenever an opportunity is available, we advertise it on our website. We also post it onto the social media pages. And if you're on our distribution list, you will also get an email sent through to you with the opportunity that's available. So if you are wanting to be added to the email distribution list, please do get in touch with us. You can drop us a message in the chat function here, or you can email one of us afterwards and we can get you added onto there. So we try and run a fair application process. We do no longer run the historical way of doing first come, first served. We now have application forms from every single person that's applying. All of these application forms are reviewed by our system partners and ourselves. So we work across the whole of Lincolnshire with the STP, the CCG and the LMC, as well as Health Education England, to approve funding for different courses. So just because you're applying on the final deadline for a course does not mean that you'll be missing out. It will go on priorities and how well you've put in your application. So once we've made the decisions, we communicate that through to the applicants. And at that point, you will need to apply for the course that you've asked for funding for. So, for example, if you're applying to one of the universities, you would then apply directly to them. And unfortunately, just because you've approved for funding doesn't necessarily mean that you'll get on the course. There may be other academic requirements that you'll need to jump through, and different checks like DBS checks and things like that. If you have any questions about the application processes, then do get in touch with us and we can go through them with you. Lisa?
So this is a little bit more about the nursing associate apprenticeships. It is a 2-year course for healthcare assistants or even people new into general practice to become registered nursing associates. That means that they will be on the NMC register at the end of their course. I suppose some people say it's similar to the old SEN role, but I think it's slightly different because they can do much more these days. So they will do their basic 2-year training, and then they can actually do extended training. So things like cervical screening, childhood IMS, and chronic disease reviews and more. And as it says, you know, it's fully funded, £8,000 to your practice to support you. So when a nursing associate or trainee nursing associate goes to university, you know, you're funded to go there. Yeah, it's brilliant. And you will stay working with your practice throughout your training. You know, it's an apprenticeship in the true sense of the word. And as it says, it's suitable for anyone, but especially healthcare assistants. If you'd like more information, please feel free to get in touch. The next cohort is September.
Hi.
Go, sorry.
Hi, so I'm just going to briefly talk about the new nursing fellowships. So this is to support sort of like a career destination. So those who qualified to come straight into general practice, so they get the support and the training that is needed to be able to fulfill the role of a general practice nurse. So this programme is a 2-year programme. It is suitable for all newly qualified nurses, but they have to be within 1 year of qualifying. So it's a 24-month programme. So the first part of the programme is a funded fundamental general practice nurse skills training programme. So we have 3 starters in Lincolnshire that started in January who are about to, 2 of them are about to embark on their fundamentals course. One is already on a fundamentals programme. So they have funding to work on a project. So that could be part of the primary care network. It could be part of the training hub. So this is to look at networking. So these new nurses are going to be doing their sort of fundamental practical skills, but it's also to expose them to the wider kind of general practice and how general practice works as a community. So additionally to the fundamental skills training, they will be offered a supervisor and a mentor to support externally to the practice. So there'll be a monthly check-in with their mentor. So that could just be an hour's meeting. It could be longer depending on the support that the nurse needs in practice. They may easily be supported they may need a little bit more support. So it's looking at opportunities, how their career is going to progress, how they're working in practice and such. So the second 12 months of the programme, that's looking at sort of like extending that role, and that could be sort of accessing training to sort of like consolidate what they've learned in the first year. It could be sort of like moving on to sort of like specialist areas. If they say have an interest in diabetes or respiratory, then it's accessing that support. And also we're sort of like looking, and we're bringing sort of like leadership into nursing quite early on. So these people will hopefully sort of like look at leadership and mentoring skills so that they can support sort of like new nurses within the future. Any questions? So if there are any questions, just pop them in the chat so we can get on to the exciting bit of the awards ceremony.
Thank you very much, Lisa. That was really helpful, but I know that we have lots of teams sitting together and individuals waiting to hear the outcome of the awards. So if we start that presentation now, I'll be presenting the awards along with Ruth Pollock from the Training Hub. I just wanted to thank the panel who judged these applications. It included representatives from Lincolnshire LMC, Lincolnshire CCG, Health Education England's Primary Care Nurse Workforce Lead Team, and Health Education England's Workforce Transformation Manager, our Medical Director from Lincolnshire Training Hub, and also the PCN Alliance Chair. So it really was a collective system scoring and similar. So let's get started, shall we? Next slide, please. Nurse of the Year is our first award. So highly commended. We have in all categories a highly commended as well as a shortlisted, and then the winner of every award. What we're going to do is showcase a little bit from the application forms and then announce the highly commended and the winners. So for this award, part of the nomination that stood out came in as follows. Sometimes you meet someone who is just outstanding and seems to be doing the job they were meant for. After 28 years in the NHS, I have met a few of these people, and this candidate is one. This lead nurse and her team have been on a real journey. 18 months ago, 2 practices were seen as failing and they were brought together under an LCHS contract. Logistically, this meant merging 2 very different surgeries and 2 very different nursing teams. Clearly, this has been a huge challenge, and the success and the way the team looks now is testament to the management and the nurse lead within this practice. The nursing team are a happy, friendly and diverse bunch, and they have a real can-do attitude, which is led from the top by this nurse, and they throw themselves into any challenge with passion and professionalism. On a more serious note, 2020 has thrown more than a few challenges at this nursing team, and this lead has found herself providing emotional support to her team. Her door is always open, and no matter what pressure she is personally facing, she puts this to one side to put the well-being of her team first. She does this because she genuinely does care, and it's an integral part of her nature. The winner of the highly commended Nurse of the Year is, from the Sidings Medical Practice, Sarah Hyde. I think Sarah and her team are here, but I can't see them, unfortunately.
They're there, Susan. They're all waiting.
Perfect. Congratulations, Sarah. Can we have the next slide, please? Okay, and moving on to Nurse of the Year. The winner will receive a full day rural reviver experience at the Grange Spa in Sleaford, a trophy which has been donated by Lincoln University, and also a £50 Amazon voucher. So the winner of Nurse of the Year received no fewer than 7 separate nominations that came in for this nurse. I'm going to go straight ahead and announce who the winner is, and then I will read the blurb because it's really hard to read the nominations out without saying the names. So the winner of Nurse of the Year is Cecilia Hughes from Colsterworth Medical Practice. And I'm going to just read out part of some of the nominations that came in. Celia has been with our practice for 25 years. That in itself is an amazing achievement these days. I call her the mother of the practice, and she is just that. An outstanding practice nurse, she is there for our patients, considers the whole patient and family situation, not just the single issue in front of her. The patients have such confidence and belief in her, and this makes a huge difference with compliance and success of management plans. She is very mindful of the rurality of our patients and offers the clinicians tremendous insight into our patients and their lives, which really helps and makes a difference to our care. She often stays back just in case certain patients turn up. She knows they're a little chaotic, so if they do, she is there. She is not asked to, and there is no expectation whatsoever. She does this out of choice and dedication to her patients, her profession, and the practice. She's a superb colleague and an excellent practice nurse, if not one of the very best, and we are blessed to have her as part of our team. Congratulations, Cecilia. Okay, next slide, please. Ruth.
Okay, moving on to Healthcare Assistant or Nursing Associate of the Year. Next slide, please. I'll start off with the highly commended. And I will, as Susan did, I will announce the name of the winner and then read the nomination. So the highly commended is Anne-Marie Hudson from Minster Medical Practice. Well done, Anne-Marie. Nomination says Anne-Marie is an outstanding member of our practice team. Nothing is too much trouble and she goes above and beyond to provide outstanding care to our patients and support the practice, always with a smile and a positive attitude. Anne-Marie is the backbone of our nursing team and this award would be extremely well deserved. Every practice should have an Anne-Marie. So well done, Anne-Marie. Is she here today? She may, we will email afterwards. So well done to Anne-Marie. Next slide, please. So the winner of the Healthcare Assistant or Nursing Associate of the Year will win a large bottle of Prosecco, a trophy, again donated by the University of Lincoln, and a £50 Amazon voucher. And the winner of this category is, next slide, please, Peter Moliapa. Now, I hope I pronounced that right, and apologies if I haven't. I'm going to read the nomination. Pete goes above and beyond for the patient he sees. However, on one such occasion during this year's initial lockdown, one particular patient was brought to Pete's attention. The patient attended for a blood test. However, the administration staff heard the patient's wife's concerns regarding her husband's health. He'd lost mobility, he had slurred speech, and had become very quiet. This information was relayed to Pete, who could have easily advised the patient and wife to go home and call an ambulance. However, Pete called upon the on-call GP for advice. He was asked to stay in the surgery while further tests were carried out. It transpired that the patient had had a stroke, but was also having another stroke whilst in the surgery. An ambulance was called, and thankfully the patient made a very healthy recovery. 2020 has been an unprecedented year, and yes, the NHS staff have gone above and beyond for patients. However, on this occasion, Pete wanted to ensure the patient received the care and treatment they needed at the time, and his whole time was spent caring for this patient until they were taken to hospital by ambulance. And this is my reason for putting Pete forward for Healthcare Assistant of the Year. So well done to Pete. Is he here? I know I've seen him popping in and out, so I believe he's also working at the COVID side. Is Pete here? May not be here at the moment. We will email him to tell him of his win. And over to you, Susan.
Thank you. Nursing Team of the Year. Next slide, please. This is the highly commended winner. Next slide, please, Sleaford Medical Group. And this team, I want to name them all because they had lots of nominations. So Rebecca Ireland, Gemma Harvey, Paige Spiller, Chrissy Ford, Zoe Harris, Mia Franklin, Kirsty Cutter, Beth Shook, and Deb Green. Again, I'm just going to take a snippet from one of the nominations. Like all medical communities, the Sleaford Medical Group has faced an unprecedented challenge this year. Wind back the calendar, and prior to the pandemic at the beginning of 2020, the SMG nursing team experienced significant staff turnover, saying goodbye to several long-standing senior team members, and as a result, lost a great deal of experience. The team faced significant pressure to continue to provide and uninterrupted service to patients with a depleted team and reduced skill sets. Then the pandemic emerged, and new ways of working were introduced at pace to ensure patients were able to access the surgery in the safest way possible. Management was refreshed and new members were recruited at the height of the pandemic. This would naturally be a daunting task, but rather than deter the SMG team, it's energised and garnered a tenacity to overcome challenges presented to all members. The new team learned to work together in very different circumstances. Externally, the workforce has greeted patients with an infectiously cheery disposition, extending compassion to all they treat, whilst internally, the nursing team recognised the importance of looking out for each other's well-being, achieved through sharing laughs, supporting each other practically and emotionally, and creating a culture of positivity when the pressure was on. In this instance, there has not been one standout act of excellence, but many small acts of kindness, support and compassion in possibly one of the most challenging years faced by Sleaford Medical Group. Congratulations. Next slide, please, and on to the winner of this award. The winner will receive afternoon tea, which is going to be delivered to your practice team, a trophy from Lincoln University, and a £100 Amazon voucher. Next slide, please. The winner is Churchwalk Surgery in Metheringham. And again, I'm just going to read small snippets out. The team embraced technology to deliver virtual consultations over the internet, as well as a telephone facility, consistently evolving the service the way they were delivering. Managing the patients with long-term conditions was particularly challenging. Many elderly and chronically sick patients were anxious regarding their conditions and frightened to leave their homes. So while some community services were unable to see patients face-to-face due to COVID restrictions, despite the associated risk to their own health, the nursing team from Churchwalk increased the number of home visits threefold. Oh, 2 seconds. Maintaining that important link with the community they serve, delivering vital care and easing anxiety. This was a most welcome service for many of the most vulnerable in the community. There was lots of, again, multiple nominations for Churchwalk, so congratulations, well done. Over to you, Ruth.
Yay, thank you. Right, okay, moving on to Student Placement of the Year. Next slide, please. So, highly commended for this award, next slide please, is Birchwood Medical Practice. I'm going to read out the nomination. I attended this practice for my placement in February to March 2020. The support and kindness I received from all the team at Birchwood Medical Practice has made me aspire to be a practice nurse when I qualify. Every question I had, no matter how silly it was always answered in such a professional and educational way. They really are the Student Placement of the Year for me. So well done to Birchwood. I know we've got Heather here. If we've got any other members of the practice on the call today, well done to you too. Next slide, please. I've got it already. And the winner of this Student Placement of the Year award will receive an afternoon tea delivered to the practice, a trophy from the University of Lincoln, who is sponsoring the awards, and a £50 Amazon voucher. And the winner is Abbey Medical Practice. I'm going to read out the nomination. The team at Abbey worked really hard to deliver quality placements to all disciplines: nurses, pharmacists, medical students, in-site visits, and soon also paramedic science placements. The team never want a student who is enthusiastic about primary care to not have a placement. At times there have been multiple students at the practice, but the team have made it work. During the pandemic, students have continued to come to the practice. Feedback is typically excellent and the team work extremely hard to promote an excellent student learning environment. So very well done to Abbey. I know we've got Lisa here. Anyone else from Abbey? Well done to you all. And back to Susan.
Thanks, Ruth. This is the final award of the day, and this is the Extra Mile Award. Next slide, please.
Penultimate award, Susan.
Oh, sorry. Apologies. So onto the highly commended category. The winner of this is Carly Hale and Alice Hill from Welby Practice and Ancaster Surgery, and I'm going to read a short part of their nomination. Carly and Alice were the spearhead of our red site that supported our group of 16 practices in responding to COVID, ensuring we had a safe place to treat patients with COVID symptoms or isolating. Between them, they supported the site every day whilst also working at their own practices. They provided both administrative, telephone and HCA support and helped with the operational design. They were the mainstay of the service, ensuring that all clinicians on the rota knew exactly what they were doing and were aware of the safety and other requirements, and helped resolve issues and continuously improve the service. In Carly and Alice, we had a reliable team looking after us all and making sure the service ran smoothly. They were absolutely brilliant and so friendly and supportive to everyone that they made a tough job fun. We have nothing but praise for them for everything that was touched by the service. I can vouch for that myself from the incredible service with the smile I received when I needed to attend the sites as a patient. Absolutely superb. I can only assume that they carry out their duties in the same manner at the GP practices, and that every patient that walks through their doors sees the same. Congratulations both. Next slide, please. And the winner of the Extra Mile Award will receive a family ticket to Doddington Hall and Gardens, a trophy and a £50 Amazon voucher. Next slide, please. The winner is Sue Smith from Horncastle Medical Group. Again, we had multiple nominations for Sue. I just want to read you a short part. Sue has been a registered nurse for many years, working for the local district nurse team and then moving on to Horncastle Medical Group to become their over 75s case manager. No matter what the workload is, Sue will tackle it head on, even picking up extra jobs on her rounds or just providing clinics at the surgery. She's there to help anybody she can throughout the day. Without Sue, many of the over 75s wouldn't cope at home without her popping in to say hello or taking their prescription round. And it's even been known for a bread loaf and a pint of milk to be dropped in when someone can't make it to the shop. Not to mention walking to patients' homes when the bad weather comes in winter. When disaster struck and the bad weather one year, Sue made the 4-mile round trip on foot to the local care home on her books to make sure they were all well and deliver medication. This was after she had walked a mile to work on foot as well. Sue works unbelievably hard and devotes her time to all her patients, new or old. She really does go the extra mile in everything she does, and she is one of the most kind, caring and loving person you will ever meet, and that's why she absolutely deserves this award. Congratulations, Sue. Over to you, Ruth.
Okay, the last award is the Outstanding Contribution to General Practice. Next slide, please. So in the highly commended, we actually have 2 nurses. So next slide, please. So we have Celia Hughes from Colsterworth and Sarah Hall from Richmond Medical Practice. So just briefly reading out the nominations. Celia Hughes. Celia has served the community of Colsterworth as our practice nurse for the last 25 years. I don't believe there is a patient on our list that Celia doesn't know. Mention a name and she can give a full history. Celia goes above and beyond on a daily basis, ensuring our patients receive the holistic, personalised care that we have come to pride ourselves on. Celia's knowledge regarding her role, the patients in the community are second to none. And at a time in her life when she should be winding down, Celia continues to give 110%, always staying to get those extra bits done on a daily basis. Celia is the linchpin of our practice and has advised and guided many team members from cleaners to doctors. Celia is a true inspiration. And Sarah Hall from Richmond Medical Practice for providing exemplary care to gold standard framework care plans to palliative cancer patients and offering support and assistance to both patients and relatives at what can be the hardest of times. Not only does she support patients, she also does this alongside personal problems, but she is always smiling. She always ensures that she has time for all patients she comes into contact with and provides compassionate care and follow-ups for all of her patients. Well done, Sarah. So well done, Cecilia and Sarah. And the winner of this award, next slide please, is Adele Parsons. And she will win a large bottle of champagne, a trophy and a £50 Amazon voucher. So very well done to Adele. the nomination. Adele always goes to the ends of the earth to ensure the smooth running of the nursing team here at the practice, and has been instrumental in bringing the practice back to where it should be after a difficult transition period as we moved under the LCHS umbrella. We could not have managed without Adele by our sides. The patients will never be left behind, forgotten, or dealt with without compassion, understanding, and professionalism with Adele. She is truly an angel and 100% deserves this accolade. So, very, very well done to Adele. And back to you, Susan.
Thanks. I think that's us. I think Helen will take us out, but also just to thank our sponsors. So University of Lincoln, who sponsored your trophies and the Amazon vouchers. BGU for monies for the afternoon teas. Thank you very much. The Grange Spa, Doddington Hall, Sainsbury's, and other system partners for their work in shortlisting and helping with the award winners. Back to you, Helen.
Brilliant. Thank you, everyone. 60 seconds and we will be finished. If I can hold you for 60 more seconds. We've ran about 5 minutes over due to the arrival of our special guest, which we're not going to complain about. It was wonderful. So I'm sure you will all agree that today has been the most wonderful, uplifting, re-energizing and positive day that's allowed us to come together, share our best practice and celebrate the Year of the Nurse and celebrate you and all of the hard work that you're doing, and allow us to acknowledge how hard you're working at the moment and how difficult it is, and thank you for it. We've had some fabulous speakers, starting with Her Royal Highness the Countess of Wessex. We had Karen Story, who came in and talked to us about inspirational leadership in the care programme. Jackie, well, where do I start with Jackie? Just fabulous, some great top tips and tools for learning disability reviews, but just exudes joy and energy. She's a pleasure to watch. We had our breakout rooms. We had Philippa and Ryan, who did the diabetes breakout room. Some excellent tips in there. Before and after case studies were wonderful. Lucy Merrill, who did the supporting students, got some fabulous feedback from that breakout room. Then we had Kerry Bennett, who talked to us about immunisations, brilliant talk, and Kelly Hutchinson, who came and talked about the wound care, and again some excellent feedback from those breakout rooms. Then finally we had the Shiny Mind app, which is free to you all and supported for you in Lincolnshire, and Ruth is going to send out the details for that, and I'd encourage you all to download that app and start to use it. And then the awards, I think I had something in my eye during that awards. It was just wonderful, really uplifting and emotional to hear what fabulous teams you've got here in Lincolnshire. So I want to thank you all, thank the sponsors as Susan has just done, thank the LMC, the Training Hub, the CCG, the SDP and Health Education England. Particular thanks to Terry Vine at the CCG, to Rosalana Pete at the LMC, Jill Beardmore at Health Education England, and of course Susan, Ruth, Lisa and Hannah at the Training Hub. You are just fantastic how you've pulled this together. If I've missed anybody out, I do apologise. And finally, to thank you, nurses, your healthcare assistants. Without you, we would not have an NHS. You are fantastic. We are so proud of you, and thank you for all that you do. And that brings us to the end of our conference. Thank you.